allow my members to know that if they have not jumped on and this is the first time they jump in here and they're just wanting to see what it's about, they can leave their mics and their cameras off just to be a part of and listen. To know that if and join when they feel comfortable. So I tend to talk until I see more people joining. So that it's not such a long lag of nothingness going on as I set this up for live stream on YouTube as well. Welcome. One of my admins had set this up. I actually just text her and said I would be on in about 10 minutes and you beat me to it. But I'm glad to see you there, and I'm glad that I got the notification that you were on, so I knew I needed to get in here and start preparing the meeting for others jumping in. So you could chit chat with me if you'd like. If you don't want to, just cool, chill out, that's fine. If you're trying to chit chat, your mic is off, just so you know. I cannot hear you. He's probably trying to figure out some technical difficulties. You can jump back on here again. So currently, right now, as I was stating, since we are live on YouTube at this time, I'm going to get this set up. I got some watchers. I'm going to send this information to. Looking for. So, I hope I didn't scare him off, but trying to think of what I can fill the time with until we get others to join. I have been doing fairly well as far as symptoms. Right now it does not sound like it. My speech issues developed probably about 3 hours ago when I started having my continuous chronic back pain. So today I was resting on a back massaging pad that you can plug in and turn on, and it was kind of painful, but at the same time I knew there was some relief to it. But as it was kind of intensifying some of my pain, I started getting some symptoms, more just tics and tremors and speech than anything. I did not have any walking issues. I was staying put anyways, up against the massaging pad. Let's see if I can get that right now to show you what I'm talking about. Massage pad. If any of you jumping on YouTube right now, seeing that I'm here alone so far. Meeting starts exactly at 6 o'clock. And as you can tell with my hair, I totally forgot one of my lovely downfalls with my FND is that I totally forgot about the meeting with a special guest tonight. And I put an oil treatment in my hair today and was counting on just soaking in the bath and washing it. And then I had a reminder when I jumped on to YouTube, but or when I jumped on our Facebook group, had the reminder, and the group knows that I usually only join the Zoom 1 day a week when I have my daughter with me. And this week I do have my daughter, so this will be my Zoom that I had, and I kind of lost track of time. Oh, we have Molly coming. Miss Molly. Miss Molly Molly. Hi, Miss Molly. We
Hi.
did
Hi.
have
Hi. Sorry.
it's all right. Okay. You got speech issues too, huh?
Yeah.
My hair's a mess. I've had to I'm constantly fidgeting with it right now. I we all lives YouTube. So here I am embarrassing myself.
I know I
Totally
was
forgot
watching it for a minute.
forgot about the meeting. And I did an oil treatment today because my hair was getting so dry and brittle. And I was planning
Ew.
on washing it tonight. And then B reaches out and she's putting on these notices, and I'm like, oh no, I can't. I totally forgot about these. So I'm gonna have to go with my oily hair. So hi Brandy. I know I have this set up to um
I'll be right back.
closed captions, and I love to see how the closed captions puts what I say down. And I said hi Brandy, but it put it down as Wendy. So I really did say Brandy, but my speech messed that up. Can you
Yeah.
guys see the closed captions?
Not on Zoom, but on YouTube we can.
Okay. Why it's not showing up on Zoom? Because I see it on because I'm right now, all I have in front of me on the computer is just the Zoom platform. Because if I had YouTube up on the computer the same time as Zoom,
Mhm.
then there's an overlap and there's an echo. So I have to close out the YouTube on my computer, and every now and then I check it on my phone. But I don't I'm not listing it loud. Oh, if I had it up loud, you could hear the delay and the echo. But I
Yeah,
see.
I have it on the TV just to make
Okay.
sure uh I'm in focus or just in case something happens I have to get off, I still have it on.
Well, I did have I was telling B that I would gosh, it was at 5:37, 38. I said I'll be on in about 10 minutes to get things set up. And before the 10 minutes even arrived, I already had someone in the waiting room in the Zoom. I was like, oh wow, maybe I better get in there now. And he was on, but he could not get his mic going. Then he jumped off. So I don't know whether he had technical issues or whether he chose not to participate, because I did state that we were going live YouTube as well because of a special
Mhm.
guest. But I just want to keep reminding people that I'm hoping it's clearly understood in the group that this will be live YouTube stream today because of our special guest. And it's important for others, globally, worldwide, to be able to see us interacting and just having a discussion, a Q&A type thing with a neurologist, and having their input with a whole group of us. And I think that that's a unique circumstance that probably doesn't happen that often. And I think that's going to be a great meeting tonight, or a chat, or whatever we have going on. I do not
Mhm.
have anything agenda wise. I don't have specifics, but we're gonna try to keep we're gonna do this a little differently than we typically do because of our guest, and to make this a little more less cluttering with too many people talking as much. So like we're gonna try to do raise our hands type thing if you want to say something, if you don't mind that. Just for the sake of the guest not being overloaded with everybody's questions. Um,
Bombarded.
right. Because we could sit and chat and flap our mouths together all the time and laugh our heads off. So with that being said, when she jumps on, what I will ask you guys all to please keep turn your mic down, and B, if you don't mind, would you like to introduce her when she jumps in? Or are you having struggles? I know you already told me that she's not showing up on my
Yeah, I'm having a little bit of struggle, but I'll be there. Don't worry.
Okay. Do you want to introduce her, or do you want me to?
Yeah, it's Doctor. I can't say his full name. She'll
I'll
introduce
just pull up
herself.
the group. You don't have to. You don't
I
have to.
can't
I got it.
pronounce. I can't pronounce her surname, but she is lovely. She's a neurologist,
Yeah.
and she's done different to the other neurologists. She's been to the conference in Italy and understands what's going on with FND, how we've been treated, and apparently it was really good over there. They're not very compassionate towards patients, so she understands how we feel. So that's what we needed in today's evening.
For
So
sure. For sure.
yeah, so she will tell us a bit about herself, what she does, and hopefully any questions you want to ask towards the end, you could ask the Q&A at the end of it. But she'll explain everything, what she does and what kind of things she's into.
Okay. Were you able to send out to her the
Yeah,
new
she's
Zoom link? Okay,
confirmed.
I see that she is welcome. We were
Confirmed.
just talking about her.
Is
So
she here?
what I'm going to do this time, see that she just jumped in, B,
Okay, cool.
is what I'm going to do then is I will introduce as much as I can, because B is having, well, I think a lot of us are having speech difficulties
Hi.
um,
Hi.
today. And
I'm
from
going.
here on, I'm going to ask that everybody but Dr. Velazquez keep their mics off. And we have B from the United Kingdom that actually set up this arrangement for us. And we're so excited to have Dr. Velazquez. I do not know how to pronounce your first name, and I'm sorry for that. But she arranged this, and I'm so grateful. If you see now, currently we have in our group about in the meeting 6 of us, including yourself, and 1, 2, 3, 4 of us here are admins of our FND W.A.V.E.S group that I have created on Facebook, and then I created the idea of creating the Zoom meetings for chit-chatting, support, ideas, and then we went further and we had one of our lovely Brandy, you wave your hand, Brandy, that's Brandy over there. Brandy is the one that came up with the idea to do therapeutic activities and offer a class once a week to show something that we do. And Brandy I said, well, you came up with the idea, you get the first one. So she taught us how to make doggy treats. And then we've had another Molly. So we've only had this going 3 weeks. And Molly, another admin, taught crochet. And then she crocheted a scarf. And B then is doing our art. And she started with our art class on this past Monday. And I think I have appointments lined up all the way to middle of August. But this is an exciting day for us because we finally have a professional that wants to listen to us as a group. And we're so excited that you are here. So I'm going to turn the floor over to you, Dr. Velazquez, to introduce yourself and and just give us some background.
Nice to meet you all. Thank you for inviting me. Thank you for having me here. Now, I must be honest and say that I am a little lost without your full names. How should I call you? Like, I have two B's here. Even that you already said Brandy, but I didn't get the second B, the one who will be giving the art class. So
Bella.
would it
You can call me Bella. Or
yeah,
B.
so I was talking to you on
Yeah,
Facebook.
it
You
was me.
reached out.
Yeah.
I see. Okay.
Hi. I'm glad to see you. Hi.
Likewise. So
Yeah.
Bella, Brandy, Michelle, and Christina. Christina, I saw you briefly, but then you went off the camera, and then Michelle. And then your name, April, is April? Or yeah? Okay. So I'm aware.
Yes, my
How
name is
to
April.
I'm aware how to call
Sometimes you see it, you will see it because I don't, forgive me, I don't know. I've said it multiple times, so that's why I might have forgotten to say it when you're on here. I also live stream to YouTube because we are all about advocating and promoting awareness and education on behalf of, you know, all of us that are diagnosed or caring for others with functional neurological disorder. So it is live streamed as well on YouTube, but so you might see my name as Mimi sometimes. That's just a little nickname, but
Yes, okay. Just for me to understand technology, is this Zoom meeting being live streamed right now, or you do live stream separately?
no, I can connect the Zoom meeting into live stream YouTube. So and it took you know, trial and error for me to learn all these things as I'm going, and I'm still learning. But there is a connection that you can take if you purchase the Zoom subscription, and you can live stream it straight into YouTube.
Okay, this is cool. Okay, so we are live on YouTube right now, and then we're on Zoom.
Correct. And these are some of our other, you will see other members, they come and go. That happens a lot in our meetings. They just, as they get tired or if they get time, so you'll see that. But what I'd like to do now is for you to introduce yourself to our group, if you can, and share your background.
Yes, and I'm sorry for so many questions. I was just trying to orient myself. Okay, thank you for that. So my name is Yadira Velazquez. You can call me Dr. V. You can call me Yadira, whatever makes you comfortable. I'm an American neurologist by training, neurologist and clinical neurophysiologist. When you go get an EEG, is the clinical neurophysiologist who reads the EEG, also with the epileptologist. When you go get a nerve conduction study, an EMG is a clinical neurophysiologist, so we understand very well the electrical flow of information between central nervous system and the peripheral body, muscles, skin, all these. During the COVID-19 pandemic, I changed my practice drastically to functional neurological disorders and functional disorders in general, education, specialization, research, writing, and doing the things that you will see me do tonight, which will be education. I don't see patients on a clinical basis anymore, meaning I don't diagnose patients with functional illnesses anymore, because I believe that good educational campaigns can serve as prevention and treatment. For example, if you take a diabetic person and you teach them a good diet, exercise, and everything about diabetes, a diabetic type 2, that person may get cured from diabetes. So that's my philosophy. We can prevent FND, we can cure ourselves from functional illnesses and return to normal functioning. So that's what I'm doing full-time now, research, education, through various modalities. So I thought that today I could do a 10-minute presentation and then we could do a Q&A. That was my proposal. So this
That sounds
10-minute
wonderful.
This 10-minute presentation is also on my YouTube channel. And if you want the slides, you can later on let me know, and then I can forward them to you. Now, I think, April, that I need to be able to share my screen to do the presentation. What do you think? That be
Yeah, so
possible?
now you have Zoom, correct?
Yes, I'm on Zoom right now.
And so you have Zoom access and right, so you can do share screen.
It says a host has disabled participant screen sharing. So I think you will
Okay,
have to,
just a minute. I will go in and make sure I change those settings.
or just make me the host for like 10-15 minutes during the presentation. And then you
And
can
have you done
record.
this? Have you done that part? Because these are things I'm still learning with it. So how do I?
Yeah. Yes, if you right, it's okay, we'll do it. If you right click on my image in the Zoom screen,
Yes.
then you can make me the host. There is one of those buttons that says make Yadira the host.
Got it. Thank you.
Okay.
There you go.
Okay, yes, and it says you're the host now. Okay.
Thank you.
Thank you, April. Okay, so let me see if I can stick to the 10 minutes. So the disclosures, I'm going to skip through this, but if you go to my YouTube channel, this presentation is there, and then I do a run through the disclosures. A lot of the information that we will be talking about has already been published in this article. So if you find this interesting and helpful, you can print this article, you can send it to family members, friends, and most importantly, any healthcare provider involved in your care or in the care of someone that have functional neurological disorders. So these concepts are published in a research article. Briefly, we're going to talk about what is FND, what are functional disorders, risk factors, so who gets it, why do people get it, what causes these diseases, what are the mechanisms that produce all these disorders and then that keep these disorders in place. What are some of the things that we have to consider in order to heal, in order to do therapy? What are some of the things to consider? And then what can we do after this presentation is over? So what are functional neurological disorders? Because functional neurological disorders an umbrella. You can have functional seizures, you can have headaches, you can have voice problems, paralysis, numbness, tingling. All these disorders are a problem, as the name says it, functional neurological disorder, a problem, a disorder with the functioning of the nervous system. When the doctors do the test, oh, the tests are fine. There is nothing wrong with your nerves, with the structure of your brain, with the anatomy, with the cells in your blood. Everything is normal. Yet, doctor, I am not functioning well. My body is doing these different things. I am not functioning well. So it's a disorder. It's a problem with the functioning of the nervous system. We have known about this condition for about 4,000 years. It's getting more and more common every year. It's now affecting children more. It started happening more after the COVID pandemic affected the world. TikTok is contributing to its causes and spread. There is even now a new variant that has been triggered by TikTok use, and is spreading through TikTok, which is the TikTok tics. It was linked to migraine, but now migraine is even considered a functional disorder. Before going to that, let's functional neurological disorders. So because the brain is so packed in its functioning and its electricity, there is one organ that controls everything the body does. And electricity, it's very contagious. Like you can give one, right? People can give electrical shocks to one another. You can get electrical shocks from your coat in the winter. If you put your finger in the socket, you may get, right? Electricity gets diffused through tissues easily. So in this compacted organ, and throughout all the nerves in your body, you can get dysfunctional manifestations through any body system, any organ, any body part, and any symptom. So when we talk about FND, short name, 3 letters, but it represents so much because it can give weakness, sensory symptoms, the tics, the tremor, the gait, the seizures, the visuals. Some people even fall into coma. Movement in the eyes, you name it. Everything that your body can do could also happen in a dysfunctional manner. So patients go sometimes to other doctors, not the neurologist. They may go to the rheumatologist with chronic diffuse pain, and they may be given another label, fibromyalgia. They may go to the heart doctor, the cardiologist. My chest is beating, my heart is beating so fast, I'm having pain. So they may be given other names, non-cardiac, chest pain, or palpitations with normal test results. So all this is within the umbrella of functional disorders, functional illnesses. It's neurological when it affects things considered neurological, like speech, walking, movement, sensation. When it affects other organs, it is considered under other names, fibromyalgia, rheumatology, specialists, you see, but it's all the same, a problem with the functioning. Okay, oh, and then this one, of course, it presents, look, all the doctors, the healthcare professionals, practitioners that are involved in your care, right? The neurologist, the primary care, the gastroenterologist, the emergency medicine, the physical therapist, the psychologist, the massage therapist even, the speech therapist, the acupuncturist. Okay, but let's go back to, okay, I know now what it is. I have a good idea. Who gets it? Why some people get it? So the nervous system receives everything, all the information from the external environment, and that electricity needs to organize itself within the body for us to do healthy functioning. Now, as you read here, these risk factors, people who have had emotional problems, stressors, traumatic experiences. So I like to summarize it to 4. Anything that overwhelms your mind, your emotions, your physical body, because that needs to be processed by the nervous system. Anything that you witness in the environment. So anything that gets to your nervous system that has been challenging, overwhelming, traumatic, can cause this energetic dysregulation. I like this picture because it represents also, wow, these things are common. Changing houses, stressors in modern life are so many, changing jobs, having some other health problems from tissues, from organs, like, I don't know, asthma or diabetes or high blood pressure or a physical injury, changing relationships, going through anesthesia, anything that puts us, and it's the same for babies, for children, for adolescents, for adults. Anything that puts challenges, strain, overwhelms the mind, the emotions, the physical body, our organism, anything that happens in the environment affects us. So how these challenging, adverse situations make the dysfunction happen within the nervous system and within the organism as a whole is complicated, but we can also kind of simplify it to understand it. So the outer boxes are all the theories that explain how we go from this dysregulation to external, from this external challenge to the internal dysregulation. So people have said, yes, prenatal, since we're in our mom's womb, the fetus can feel the things that are happening. Stress theories, epigenetics, so how the environment shapes our genes, attachment theories, meaning the way we relate to our caregivers and parental figures, and also, of course, makes us feel a certain way, believe certain things. Social conditioning, the things that society teaches, social learning, hypnotic suggestions, whether other people make you believe, even marketing strategies out there. Adult stressors, trauma, being it mental, emotional, physical, social, and even when the scientists don't know what happened, or when the patient says, my life has been perfect, nothing has happened around me ever again. Even when people say that, the same processes inside the nervous system has been demonstrated repeatedly across populations with functional problems. And this is a very summarized and simplified model. Now, the number of processes that we are aware of are numerous, but we know that there are 4 aspects of the nervous system and the mind-body connection that get affected. Neocortex, where the thoughts, the beliefs, the perceptions, the interpretations are. The neocortex, the intellectual brain that makes us think, and talk, and do. There is another network, which is the limbic system, or the emotional network, that also can get affected with all these situations. There is the automatic nervous system that controls the heart rate, the breathing, the urine production, the bladder, the bowel, the digestion. The automatic network part of the mind-body functioning can get affected. And the somatic network, which is, soma is the old name, the Latin word for physical body. So these voluntary things that we do with the physical body and the perception of the senses can also get disrupted, these processes. So I like to simplify it to, my presentation is a little bit disorganized. 4. Oh, and these neocortex, so mind, emotions, automatic processes, and physical body, soma, they have a conscious component and they have a background subconscious machinery. Like now your conscious attention is on the screen, but your heart is beating, your soma, your muscle tone is maintained. You may have some emotions there in the background, like, oh, this is annoying. Oh, wow, I'm excited. This is interesting. Or I'm sad because something happened. There are some emotions in the background. So you see there are conscious things happening and background things happen that you can bring to your conscious awareness through guiding your attention. So to simplify it, mind, emotions, body, and the body has the automatic part and the voluntary part. Mind, body, emotions. Mind, body, emotions. So this is, okay, the mechanisms of disease production. Let's go back to, sorry for making you, risk factors, causes, mechanisms of disease production. Oh, therapeutic considerations. So we went through this. All this we saw, mechanisms of disease production, we saw these pictures, everything is under control. Therapeutic considerations. So the problem is that cognitive behavioral therapy is still the most prescribed therapeutic modality, but that targets mainly the cognitive mind, the intellectual processes. Very little targets for the emotional network, for the sensory motor, for the physical body. The cognitive behavioral therapy doesn't do much. For that, you have to go to occupational therapy, speech, physical therapy. And for the autonomic nervous system, the automatic functions, cognitive behavioral therapy doesn't do much. So as you can see, I show you the 4 aspects that are problematic or dysfunctional. However, the modalities don't focus on them all in an integrative, comprehensive manner. In my articles, you're going to see all the problems that are still affecting the therapeutic and treatment world. And then the preventive strategies, like, they do not exist, like they are not teaching us how to prevent this condition in children, in ourselves, how to prevent worsening, how to prevent recovering the symptoms that we may already have healed. So that's how the world is right now. But hold on, what can we do now? Because I'm an optimistic person. So I believe, as I said in the beginning, that through learning, we can do prevention and we can do self-healing. Why? Because, for example, let's keep it simple. If we fracture or if we had a stroke is another disease of the nervous system. If we have a stroke and we lose the function of our arm because of a stroke, then how do we regain function after the brain has been damaged by lack of blood flow, with proof in the MRI that the brain tissue was damaged? Then you repeat the normal function of that body part and that associated nervous system area. You repeat the normal function and then you recover your function. But not completely, because in a stroke there was tissue damage. In functional disorders, you don't have, for the most part, you don't have tissue damage. So I believe that if we learn how to recreate normal function, we can start healing by ourselves, and then we can also prevent. So I teach about this. I teach about, okay, what are the abnormal processes? We learn to do self-assessment, and then we do to regain the normal functioning of the body in all the networks, the categories. So you see, I collaborate. I have my own educational programs and research programs. I collaborate with FND W.A.V.E.S. I don't know if you're aware of FND W.A.V.E.S. They have also like classes and support strategies, and they do research with a whole bunch of doctors and universities. They are a good source also for education. And of course, and I collaborate with them, and I have my own educational models. Some of them are free through research, some other space. But this is what I teach people through my website, Science and Shamanism, because I believe there is a spiritual component, the same way there is a societal component. So society, religion, spirituality, all that is kind of embedded. So I use nature as a spiritual healing source. This is what shamanism is a philosophy of nature. So this is what I usually recommend my patients for education. And I didn't know you existed, FND W.A.V.E.S. And this may also be a good learning and practicing network, it seems, for all of you. So I think you can recover host status, April, and I am done with the presentation. I'm sorry it took a bit over 10 minutes.
Thank you. Thank you so much for that information.
My pleasure.
Let's see how I get that. 1 second. I don't have that. I cannot find my ability to take on the host. Oh.
That's okay. And you know, one thing that we could do, I could exit. That will reassign you the host status, and then I come back after 30 seconds. Do you want us to do that, April?
We could try that. Yes, that's
Yeah?
true. That's
Okay.
fine.
Let's do that.
I'm so excited to see you all here. I'm going to
Hi.
ask, as we're trying to get on, if everybody keep their mics off, and if you want to ask a question when she pops back on, if you see down below, you can have a reaction to raise your hand, and then I'll allow you to be unmuted. Thank you. That worked. I think it worked. So just to give a little bit of background of my group and where we came from, when I developed FND 5 years ago, I found FND Hope, and sought them out myself. And I am very excited for all the work and the research they have provided and all the resources they also provided. And I was asked to become a volunteer admin on their Facebook group. So I am a volunteer admin also with FND Hope, through, I think, 3 different various countries, internationalities. But part of the thing that I decided, I made my group the same time that I became an FND Hope admin, but I did not know where I was going with my group. So I really didn't do anything very vivacious or anything crazy. And then I noticed this past October, I don't know what drew me to do it, but I happened to look in my group and all of a sudden I have 500 members. And today I now have almost 3,000 since October. And what I have been doing in the group, because of my background, I was a special education teacher. And 2 years before I developed FND, I took a hit to the head from a student. And I was told by my neurologist, but not the workman's comp neurologist, that I had received a traumatic brain injury at the cellular level. So that took me on a journey on its own. And then, of course, when the sudden onset of FND, where I pretty much have every single symptom under the sun, it affects every body system that I can think of, except for maybe my skin. But I wanted to, I didn't want to stop teaching. And the hardest part, I think most of us here can say, after you've gone so far into FND, the hardest, you learn to.
You muted yourself. There you go.
I got it. Yeah. So the hardest part, I feel like I got to speak for most people in the group, is that after, you've come to that realization that it's probably just better accept it for what it is and move on, because the lack of therapies or the lack of directions doctors are providing to us, that it was like, okay, so I got to accept it. How can I integrate this into my passions, and what can I do with my passions? And so therefore, in my group, I decided, I think part of the need that I was seeing happening in the FND Hope groups, due to regulations, because it's such a big foundation, it wasn't being allowed. So in my group, I'm allowing more freedom, I guess, to speak, And then I've also taken, I started the Zooms. So we do those, we have them throughout the week, many of them. Some, and it's really difficult to just create the schedule with various different time zones. That's a challenge. But I get on as I feel, and I have been reading. I started reading a cognitive behavior therapy book to my group and saving those into our guides, and they can go back and rewatch, and telling them to journal alongside each task. And I've also just currently, let me get you this, you might be familiar with this book. Just currently finished reading The Power of Now by Eckhart Tolle. I don't know how many members have actually listened into my book readings. And I've also told them they can access these for free as well on YouTube, because Eckhart Tolle has a phenomenal voice. I've been reading that, and like you said, I have seen a tremendous change in my life and my symptoms, and I'm able to control them more so in the if it's more like a mental spiritual trigger versus a physical or sensory trigger. I have not mastered that yet. But I have been able to prevent my seizures now with no medication. I weaned myself off of antidepressants with the help of my doctor. And I am just finding that the positive and the connection and the compassion that the group shares together as a whole has also brought some hope to others. I feel and I see that we're connecting and making such great strides in relationships and offering so much more. That's what we're, trying to achieve. There's so many things that we have going on in the group. So that's where my background in FND W.A.V.E.S started. And I felt that waves came from the phases that not only are symptom phases where they can seem to appear in our electrical phases throughout our body, but also our mental phases where we feel like warriors, advocates, victims, enigmas, and survivors. So it felt becoming to do that. My goal, not only with the group, is also to create another nonprofit organization that will help others obtain medical equipment, in the beginning if necessary. Also provide assistance, financial assistance if possible, in the midst of that transition from no work to disability and or until we are healed. Because what I'm hearing you saying, Dr. V, is that there is definitely hope. And I'm glad to hear this because unfortunately, recently, since I've had this for 5 years, I've encountered more battles with my physicians than not. And it saddens me because I had a very long relationship with my own personal, my PCP. And literally in June, I had to let him go because he was causing me more stress and symptoms than it was to be a healthy situation, a healthy patient-doctor relationship. So, with all this being said, I do have a very important question. I believe what I'm seeing also within the FND community and with medical professionals, that there's a big chance that other neuromuscular disorders or conditions can be very easily overlooked. For example, I have, with Celine Dion and her diagnosis of stiff person syndrome, being an autoimmune type disorder, and brought to my attention somebody that was diagnosed with FND, but her mother didn't feel that was the right fit for her. She felt that there was something more after doing lots of research. Later, to find out that she had periodic paralysis, another condition that could have a lot of resembling symptoms. So are you aware of these types of other conditions that maybe could be possibly being overlooked or not being tested, or just because I know that it seems that this fast-paced society that we're in these days, doctors tend to have to focus on a specialty. All neurologists almost have to pick a specialty. So the patients have to find that neurologist in that specialty. Are you seeing that this is a kind of a common
let's see. Misdiagnosis exist in medicine, like mistakes exist in any other professional field. Now, there are two types of misdiagnosis that can happen around FND. One is, I have a functional disorder and I am given a structural anatomical disorder. For example, I have FND and I am given the diagnosis of a stiff person syndrome. This can happen. There is the other way around. I have a stiff person syndrome. I am Celine Dion. I believe that Celine Dion, I hope she got the right diagnosis, right? With having so much money and so much access to the doctors. I hope that her diagnosis, yeah. So I have a stiff person syndrome. I have a stiff person syndrome, but I was given the FND diagnosis. So you see, misdiagnosis happen in both sides. science is proving that the highest misdiagnosis that is taking place, and actually the most dangerous misdiagnosis, the one that you have to avoid at all costs because it can harm you tremendously, is to have FND. My problem is with functioning. My body is not functioning well. I have FND, but you're given an organic diagnosis. Let's say you have FND and you're told that you have a stiff person. That's dangerous. That's worse. And that's what is happening the most. So you have to be careful with your doctors telling you, no, this is not FND. This is X, Y, and Z. This is what's happening the most, and this is the most dangerous. Why? Because then they recommend for X, Y, and Z surgeries, invasive procedures, a lot of testing that was not necessary, a lot of IV medication, a lot of oral medications. So this is what's happening the most. And you said it because doctors are so used to practicing within their specialty, within their field, and doing a lot of testing that they are still so unaware of functional disorders that still they think more. Actually, they may think about a stiff person syndrome and a periodic paralysis maybe before FND, because FND is not being taught in schools, in medical schools, but the stiff person syndrome is, and periodic paralysis is. Am I making sense?
Thank you for clarifying that.
And you're right, the fast pace of medicine. There are many problems associated with the healthcare system that is causing the confusion. And you named a couple, so I agree with you on that.
Right. Thank you for clarifying that. Right.
And
I have just, go ahead.
Just one last thing. And it's important for you in your group to be honest and name and talk about the healthcare system problems, because you can change the system. And I see you growing in your movement. You have said a lot of positive things that is coming from your movement of FND Waves. So put this in your topic for discussion, healthcare system problems. Let's name them. Let's talk about them. And from that, you can bring about change, political change, social change. Even if it's changing one doctor, that may already be good.
That is, I did start a petition on that actually, as I have it moving right now as we speak, but yes, thank you. That's where we're going. But I'm going to allow enough of me talking. The group knows I'm a chitter chatter, so I'm going to allow them to ask you questions. So Jess was first. So go ahead, Jess. Your mic is off still, honey. You have to unmute yourself.
That's fine. I was trying to lower my hand. There we go. Hi, Yadira. I was in the FND Hope Group 1, Level 1 with
Yes,
you.
I thought you looked so familiar. I thought so. I'm glad you said it. Okay, I was not gonna say.
You're wondering, like, why does she look familiar? It's me. I really struggled in that class very, very much. And I can the thing that was really struggling the most is that I could understand cognitively the goals, the reasons we were doing it, the understood the cognitive reason for the exercise. And I found I actually never participated the entire time. I don't know if you remember that, but I really couldn't bring myself there because the personal experience that I was watching other people able to kind of go into their bodies and experience these emotions, or at least it seemed to me that I could see that they were experiencing emotion. They could see that they were able to start bringing some of the stuff to the surface within descriptors. And I was not able to get there or understand it. And I started to realize through this process, that I have a very, very delayed response or to finding out what it is in a cognitive manner, what's going on with me. And so I wondered if in your practice, you've obviously seen dozens of more people since I saw you last fall. Have there been any people that you've met up with that maybe experience similar things where they're sort of understanding the cognitive steps but can't embody the the things. And also like I cannot visualize in my mind. I have like aphantasia, honestly. And so I felt like a lot of those, the same thing from doing yoga for years and trying to like, oh, imagine you're here. I had no idea people are actually like going away on a little vacation in their minds. Like, you all suck, you're all jerks. I'm so glad that you can all do that. But I just wondered if there's anything that like you've seen in your practice since then of people who are trying to overcome that hump, because I feel like I have moments where I can embody it and like that's better than it was, but like it's not, I don't get it. So that's my question ish.
So, so the simple, quick answer is yes. And you are saying it. I have noticed moments in my own body where I can tap into my emotions and tap into my body. So you're an example of it, even if it's for small moments, and every small moment counts. It's like after a stroke, when you're like, yes, that counts. That's the beginning of the healing. That's the beginning of the recovery. Yes. And it's so common, Jess. Your experience is the most common. Why? Because we human beings in modern society, we have become so intellectual, so cognitively, that it is overpowering the other networks. So it is the most common to take some time to allow the mind to relax so the emotions can talk to the mind, the body can talk to the mind and deliver the information, the autonomic nervous system. So your experience is the most common one and you're making progress. So yes, we all can do it. Why? Because we're biologically designed for healthy function. We just need to clean a little bit some of the pathways that have gotten stuck. But we can do it. It's not easy. It's not simple. It doesn't take, listen, my first research, I just finished it. It took 1.5 years for like meaningful change that now the group is moving to collaboration with me. They are no longer my students. We're the same level. We know the same stuff. So it takes time. I would say 1.5 years. Some people sooner, of course, but for now. And actually, the journey of healthy functioning is a life journey. Why? Because we change. Healthy functioning is different for children, for adolescents, for when we're in our 20s, in our 30s, in our 40s. So it's a constant adjustment. Like, wait a second, I'm now 40. How is it done now? And in 50, and it's scary, and the emotions and this and that and society. So it's a life journey. We just need to learn the foundation on how to do it. And then that's it. We can ride the wave of living. Thank you for your question.
Sure.
Thank you.
Fun times.
And I can feel your emotions over here. We're in this together. And I
Yes.
celebrate them. I celebrate them.
It's just like it was so funny because it almost felt like I was taking like another algebra course again where I would sit there and be like, all those are words. Yep, she's saying words. I have no idea what's going on.
Things have
So
changed. Things have changed.
yeah,
Yes. Now you're feeling it.
an absolutely amazing therapist who's we've been trying all these different somatic practices. And I think a lot of it's clashing with some of the somatic treatments are clashing with my triggers. And so it's like, okay, well, we can't do that because that just like triggers a movement. And so we have to like really adjust and find out what it is that we can glean off of other people's work. And then what we have to do because I am my own person and I have different things going on. So, yeah.
Yes.
Thank you, Jess. Molly? You have to unmute yourself.
Oh, sorry. I have multiple questions.
Throw them at me. I'll try to make one good answer for them all.
The first one was, how long does FND hide before it shows up? Because I had multiple stressors all at once within a few months before it even showed up.
Good question.
Do you want me to answer them one by one, or you want to tell me all the questions, 2 or 3?
Oh, I couldn't say all of them. The next one was, what is the difference between spiritual and physical triggers? I don't understand that one. And how can you know that you have the right diagnosis?
They're good questions. Okay, let's. Am I having some this is weird, some noise.
Oh, I have a fan on. Hold on, I'll mute myself.
What's happening? Oh, it went away. Okay. Okay, so how long FND hides before becoming manifested? How long the energy dysregulation can be like cooking inside the system? It can be many years, it can be decades. I think it depends on the magnitude of the challenge that gets at you. Because bigger challenge, you will not be able to contain the energy. Like, let's say, 2 bigger challenge, most likely you will have a sooner manifestation as opposed to, I don't know, 20 smaller challenges, right? So it depends on this, but it can be decades. And I have students that when we start like trying to figure this question out, they say, well, now that I know that all these were signals of the energy dysregulation, I think the energy problem started since I was a child. So it can be decades. What's the difference between a spiritual and a physical trigger? So physical is from our skin inwards. From the skin inwards, you have the physical, the autonomic, the emotional, the mental. Skin inwards. Social, environmental, and spiritual is from the skin outside. Social is kind of the closest network. Environmental, I don't know, maybe the country, maybe, right, something bigger already, like including the trees and the weather. And then spiritual, then you move even outer into a space and you start considering the influence of the sun and the clouds and the gods and religions and your ancestors and people who die, like where do they go, right? Like it becomes infinite as the universe because energy follows physical laws. So we have to consider all these factors when we talk about the energy inside us is influenced. It's influenced by the greater spiritual realm as well. And how do you know that you have gotten the right diagnosis? Well, there are some hallmarks. What are like the 2 or 3 hallmarks that we should always remember and tell people? Fluctuating. There's a fluctuating nature of the disease, right? And not only the fluctuation in time, like sometimes it's here, sometimes it's not there, it's the fluctuation in duration. It's so variable. Sometimes I get the symptom for a split second, sometimes I get it for 2 weeks at a time. It is also the variability, right? Because energy is like this. Energy fluctuates, it moves, it varies. It's the variability in manifestation. I got the tingling here, but then I have the generalized fatigue, and then I get the headache. So this is it. These are some of the hallmarks. And then this is opposite to a structural anatomical problem, which is usually localized in one area. So it tends to be more, especially without treatment, like there is a constant worsening in that area in the same symptom. Right, the fluctuation. And then if you get the fluctuation associated with the other networks, with society, with environment, with emotions, with thought, then you're like, energy is moving around networks. So those are some of the hallmarks. But whenever in doubt, write a good conversation with a good doctor. Like, hey, can we really review this together? Doctor, could it be this? Could it be that? Tell me why not? Like, I really want to understand it. It's so important to have a cognitive understanding and certainty. So you get the opinion, but you also feel your own body. Tap into your body. And you're going to get an inner sense too. Remember, we do this, your bladder, when you feel pressure in your bladder, your mind knows, time to go and pee. When your stomach is growling, it's a signal, time to eat. So we are already designed to uncover the meaning of the symptoms, the sensations, and the signals. So do a little bit of that exercise. A little bit. Breathing through, sometimes it can get scary because the mind is not used to it. But little by little, play around and explore yourself. This is always going to do you good. And I think Julie has her hand up. And Julie, I can take your question because I think April is busy at the moment.
Hi. Is FND a disease? Like, what's the name for FND? Is it a disease? Is it hereditary? Where does it come from?
Yes, it's a disorder, right? Like they call it functional neurological disorder.
So what's the difference between a disorder and a disease then?
Yes, you see, you have put me on the stop on YouTube Live and on Zoom. And how can a doctor not know this basic, like level 1 in medical school, right? Different. You see, you're a smart person, Julie.
I've had it for so long. I've had it for over 30 years.
But you see, like this one, I would trust Google or I would trust a dictionary. This one, we can trust the dictionary. We can go and find what is the meaning of a disease? What is it? The meaning of a disorder? And then you ask, is it hereditary? This is this one I can answer. So you see, we inherit certain traits from our parents. Certain traits that can be conducive to more health or to maybe less health. For example, like certain personality traits we may inherit from our parents. And we know that certain personality traits may put us more get diseases, like, I don't know, like risky behavior or inflexibility, like someone is telling you or teaching you, but you're very set on your way of thinking, like certain personality characteristics that could be inherited. We inherit some predisposition to chronic illnesses. And we know that FND can happen more when there is already a chronic structural illnesses. So no, it's not an inherited disease. It is not. But we could inherit certain other traits and factors and diseases that could predispose us to our energy becoming dysregulated. It is an acquired disease. There is another genetic component here that is, there is an epigenetic mechanism that causes FND, which is we have our genes, right? We're born. We have mass, and our cells have the genetic material inside. But then the environment, the relationship with our parents, the school, the food, what we watch in the TV, the sleep that we get, the silence, all these things start shaping our genes. And our genes start adjusting to live in that environment.
So basically life.
Exactly.
Life, just living a life.
Yes.
So it's a matter of adjusting your life to what's good for your body and for your mind, and take it as the book says, now, not tomorrow, not yesterday, now. And that's what helped me with that book. But I'm glad you answered that. I appreciate that. Thank you so much.
Yes, this is a very good book. Eckhart Tolle has been one of the people who have influenced my work the most.
Oh, really good.
Definitely recommend it. Yeah.
Oh, that's what book? The Power of Now?
Yeah.
All his books and his lectures.
Oh.
I had 1 year of binging in his work, and it was fascinating and transformational. Yes.
I do have a testimony of my own journey with that. I had
Before you say that, April, sorry, I have a hard stop in 2 minutes, but
okay,
I'll
good.
stay
2 minutes.
because I want
Okay,
to
this,
hear at least part
I'm
of
not
it.
gonna
Tell
take,
me.
okay, I'm not gonna tell anybody else's, if anybody else has a question, I'm gonna let them, because I'll tell my testimony after you leave. But anybody else have any questions for Dr. V before she gets off? And I do thank you for joining in and giving that information. And I hope to see more Zooms like this so that we can have some, questions and stuff clarified. And then, it's great. And no, don't feel bad. We're all human. I actually looked it up for you. The difference between disease and disorder. If I can answer that for Julie real quick, it is a disease is typically refers to a specific pathological condition that involves a set of symptoms and signs, and it is usually identifiable causes, such as infections, genetic mutations, or environmental factors like lung cancer due to smoking, where a disorder is a term that is broader and can encompass a wider range of conditions that disrupt normal bodily function or behavior. I just summarized that. So if that clarifies a little better for you, and I
Thank
just took the
you.
workload off of you, so no
Thank
worry.
you. Thank you.
I keep my little handy dandy technology right next to me.
Okay, before you go with these questions, because I really have to go. If you send me any remaining questions via email, then I can answer them. The other thing is, I'm gonna send you a link to this brief 10-minute presentation. You can, if you want, I come another time just for the QA, no more presentation. Like you have the link,
That'd be
you have
wonderful.
this link now, you can share it, and then we can just do QA, more QA another day, because I feel that the QA is the richest part.
Oh,
So
I do
thank
too.
you very much. I really have to go,
Sure.
but send me any remaining questions via email, and then let's stay connected. It has been a pleasure. Keep
Thank
it
you
up.
so much.
You can get better. Yes.
Thank you. Thank you. Thank you. Thank you, B, for
Bye,
inviting me.
bye.
Bye-bye.
Thank you.
Have a good evening.
Bye, Bella. Bye, Bella. Thank you.
Right. Thank you, Bella.
Bye.
Everybody say
Bye.
thank you. We're all now free to do our chit chat like we normally do. Everybody, please thank Bella for doing that and setting that up. I wanted to give her the
Thank
floor and
you.
post to her.
Thank you, Bella. Thank you.
That's all right. That's okay.
Wanted to
No
give it to
worries.
her, but she was having speech issues. Then she was like, "Here, April," and I'm like, "Oh, don't do that," because I was too. But then it actually, by me doing that, thank you. You actually helped fix and correct my speech, so appreciate that.
Thanks. Good. Good.
So
Excellent.
can you believe that she totally 100% most of her work is based on what I've been reading? Is that coincidence or not?
That's good. That was meant to be.
This correct thing. It was the correct thing you done. And
Yeah.
she just said, read all his books. And it's helpful.
And this
Yeah.
is on YouTube. So I also want to reach out and say thank you, Eckhart Tolle, for all the work you have done and putting this
Mhm.
accessible. You have saved many people's lives through their functional disabilities that we have all been suffering with. It's a work in progress. It's not an easy, it's something you have to continue to do and be mindful of doing. That's where I was going to share my testimony on it, where I was introduced to the book years ago. And I had breaks and reservations on it because of my belief system is very strong held in the Christian faith. And when I saw this, I thought, yeah, is this going to be some sort of rubbish trying to pull me a different way where I've got my roots already set? Is this going to be something that's going to try to pull? But I said, you know what, there's accountability. If I read this with others, I might find that there's some value. We can learn from everybody's different belief systems. And I'm sorry, my dad's TV is so loud. He's a bit deaf. But Kettles, no. But as I read, I was very highly impressed, speaking as a former teacher, of the vocabulary he chose and the verbiage he chose to use in here to be so neutral that it can be used with any belief system wholeheartedly. And
Yeah.
what I did is I mindfully went into my readings with you all and kept in my mind that I'm going to practice alongside the Holy Spirit for me. And knowing it may be a different journey for Julie or Molly or B or Brandy or Emily or Mitchell or Jenny. But the only way I can share examples would be just what I know, like how I did it and how I used it. So, the one thing I love about the group, and if people don't love it and they don't like it, they leave or whatever, but is the fact that we
Right.
are so compassionate with each other and respectful to each other, that we all know that we all have our own values, cores, beliefs. And one of the biggest value, core, and belief that we all share is compassion and respect for each other. And I thank you all for that. That's one I couldn't do this group without all of that and with all of you doing that with that. I mean, that's the steadfastness of the group. That's what makes the group. So I appreciate that with all of you.
Yeah.
With that being said,
I have a question.
yes, Miss Molly.
Can someone re-explain what the difference between spiritual and physical triggers? I couldn't really understand her during that part.
Well, it's for what part of what she's stating is some new research, of course. The other thing is I'll give a summary based on how I understood it this quickly before I actually can get into her information that she's got available. But the way I think I understand it is physical, of course, is going to be okay, pain. If you get triggers from pain, like I have triggers from pain, that's a physical trigger. I also get triggers from not eating quick enough. So it's like a blood sugar a physical thing. When we say spiritual, that can be inclusive of emotional health as well as your social environment and your core value system, your belief system. So spirituality triggers can come from core values. Your emotions can include a host of I guess, lack of better words, the non-visible or you can't feel it or sense it, is like where it's your body, like you could feel a blood sugar going down because you start to and then they can test blood sugars and you can see that your blood sugar is low, and therefore usually that you become familiar time and time again with that. And pain you can feel physically. So is that kind of clarifying some of it until I can get into that information she has provided?
Yeah, it does. I just got really confused really fast, and plus I have a cat that likes to jump on me in the middle of stuff.
I was trying to keep mine off me too. Not cat, but dog. He was really being a nuisance. But
Oh no.
I'm hoping that we can keep doing more like this, because if there is any confusion, doctors have the research and they have that knowledge, but I also have my past experience as a teacher, and I can help to take what they say so that it's understandable for all of you. And if I can't figure that out, I'll dig until I can, or I'll seek out that from that specialist or whoever until I understand it, because I'm not a good teacher if I can't understand it myself. And you guys have allowed me to be teacher again, and
We need you.
that's amazing. It's given me hope, and it's given me it's crybaby again. It's just given me
Oh, April.
life and a reason, and
You're doing so
I
well.
just love you all. So I'm gonna let somebody else talk.
It's all good, girl. I'm not laughing at you. I just love how emotional you get. I love it because you're so deep into it. And this did bring you back into your teacher state. which is beautiful because we need this. We need this.
Mhm.
I want to ask, I don't know if I asked this before. I my memory is not there anymore, but because I haven't been on for a while, it's been hectic. But anyways, does anybody have sleep apnea at all? Yeah. Okay. You have a CPAP machine, so you use a CPAP machine.
I haven't been
So
lately, confession. And my throat has been hurting because of it, and my sleep has been kind of groggy and like not quite as alert as I normally am. But with my
Okay.
setup right now and just just my
So you
scenarios
can't.
kind of prevented me from using it.
So you found that when you're not using it, it affects you, right? Like you kind of your sleep is not
Groggy
good.
headed, yeah. You don't
Yeah,
sleep as
yeah,
well. You're up
yeah.
like last night was awful. Like I felt like I could have heard a pin drop in the room and
Mhm,
I would have woken up. Sometimes,
yeah.
well, when I am taking it, I have the greatest, best, deepest sleep I've ever had.
And do you
And the
find
good
you
thing is,
dream a lot? Do you find that
finally,
you dream a lot? Yeah.
that's an interesting topic because prior to FND, I think probably for 10 to 15 years of my life before FND, I couldn't remember a single dream. I didn't remember a single dream. And then once FND came, it was nightmares, constant nightmares. And
Oh,
then
wow.
then the PTSD diagnosis,
Mhm.
worked through that stuff. And now I am dreaming. And last night, all my dreams were all spiritual.
Oh, that's great. That's
Yeah,
great.
they were all spiritual in nature. They were
So
they weren't
it all
scary.
All my
it
dreams are
almost
based on TV shows.
What?
pardon
All my dreams are based on TV shows.
on
And you
TV
watch a lot of
shows.
TV.
Oh, Molly, that's hilarious. Oh, that's cute. You know what, Molly? Maybe you could write your own TV show now.
Right. In your dreams.
Hey?
Put a pad when you go to bed. When she goes to bed, she needs a pad of paper and a pencil so she can get ready
Yes.
to write in sleep.
I do.
Next script.
Yeah.
I have
You do.
2 notebooks and 2 pens right next to my bed
That's great.
There you go.
because I'm
You
also
could write your
trying
own
to write
TV
a
show.
book.
Right. Hey guys, I'm not leaving, but I need to put this on my mute and I need to hide the camera. My daughter fell asleep. My dad and stepmom are eating, and I need to take the dogs potty. They're roaming around aimlessly. So I'll be right back.
Good,
You guys
Scotty.
talk freely as you wish, and I'll be right back.
Yeah.
Okay. Okay. Mommy's leaving the house. Yeah, we can get crazy.
Where's Brandy? You still ready? You here?
She's still hidden.
No. Oh, maybe her mic's off. Her mic might be off, eh?
Yeah,
And
it is.
Mitchell and Amy. Who else is here?
I don't know. I don't know how to get everybody. Like, how are you guys getting everybody?
You move to the side.
I could see them. Hi, Mitchell.
You move to the
Hey,
side.
Hey, Mitchell.
You can put
Oh,
on the
okay, I got it.
President Michelle.
Hi.
Okay. Oh, there we go. Okay, good job. There, thank you. Thank you for that instruction. I didn't understand what was going on here. Okay.
Yeah. Right,
Okay.
because I haven't seen Mitchell before. So, do you want to introduce yourself to the group?
Yes. Hang on. Can you hear me?
Yeah, we can hear you.
Yeah.
We can hear you.
Oh, yeah. So, well, with my journey anyway, I've been diagnosed about a month ago.
Okay.
Oh, okay.
Just pretty new.
Recently went to hospital. I had foot drop, tremors, a few other symptoms as well, and I've also got immune diseases too,
Yeah.
which kind of makes things a bit more challenging in that respect.
So,
But
did you have the
yes,
autoimmune before FND?
sorry.
The autoimmune disease. Did you have that before
Yeah,
FND?
that was about 2.5 years ago.
Okay.
Oh, okay.
You did say,
Yeah, so
just explain to us that you either could have FND or the other symptoms and then you could have FND later on. So it makes sense now.
Yeah. So from what I've been researching, that's it's kind of how it goes. I think for some people, not everyone, but yeah. So yeah, I've just joined your groups and just trying to find all the information and everything that I can, so I can try and navigate this this new this new thing for me. So yeah, I've been like really grateful for the talk today and all the information you've given and everything and the support. It's been really great. So yeah,
That's
thank you.
good. That's all right. I mean, you could still you're based in UK from your
New
accent.
Zealand.
New Zealand. Okay. We've got on Thursdays, you can come and join us, or we've got other days as well. You can come and join the group if you want to.
Okay.
Up on schedule, so I'll let you know. I might personally message you. So I don't know your first name. Is it Mitchell, your first name? Yeah.
Yes, Mitchell, first name. Yeah.
Okay, so I'll try find you and
Okay.
try get the link. I'll put it on our chats and let you know. And so you can get times you could join. Okay.
Yeah.
But
No, that'd be great.
It's great that you joined, and I've got the similar condition as you. For me,
Okay.
was FND, but autoimmune disease later on. So
okay.
yeah, so it works different ways for different people.
Yeah. No, definitely.
Talk more later, so you could come and join one of our class Zoom chats, and I'll show
Yeah,
you
no.
days.
Yeah,
Okay.
that sounds
Cool.
good. Thank you. Cool.
All right. Is it Emily?
It is.
Hi, how are you doing?
Hey, I'm good. I'm
Um,
new to all of this, so I got diagnosed similar to Mitchell. I got diagnosed in March of this year, following an assault that I got of last year, where not only have I been diagnosed with FND, I have 8 discs in my spine from my cervical down to my sacral area that are impinging on my cervical cord, and I have a torn rotary cuff, and it's pretty much impacted every part of my life, taking me from being, having 3 jobs to now not being able to do anything. So I was, my partner found the group on Facebook and suggested that I came on and had a look, and I can't thank you all enough for everything you write about, and I just feel now that I'm not so alone. I'm from the UK, and there's not much knowledge about it here, and nobody really speaks about it, or people I do speak to, nobody really knows. Doctors, GPs, they don't really understand.
I know, that's what I felt like, was like there was no information before in UK. I didn't get it. It took me a while to find this group. I've had it for over 7 years, just altogether now. I had it due to head injury. So because of that, a year later, FND. Then after that, a couple of years later, autoimmune disease, which I don't know which one is yet, because they're still trying to diagnose which one it is. So yeah, it takes a while. But I have organised for the UK and other, like Australia, New Zealand, other places, to come and join us to do Zoom chatting on Thursday. So it works better within our time zone. So we could chat more, do that.
Yeah, that'd be brilliant. Thank you.
Yeah, but do you want to explain a bit more what happened, or do you want to do it another day?
No, I can explain a little bit. There's still a case going on, and police and things are involved. But unfortunately, I was at work, and I got injured by a colleague while at work.
Gosh, okay.
So I've endured all of my injuries I've sustained were through this member of staff that they did to me on that evening. So I've also got PTSD and have nightmares of everything that happens. So what I thought was, being a nice person and helping somebody turned into a life-changing scenario for me.
That's what happened to me as well. Yeah, but it was a family event.
Yeah, it's really hard. And I mean, it's impacted on my family life, my personal life, everything, my work. My union are saying that I'm going to have to be made medically retired. And being 37, it's not something that I thought would ever happen this early.
That's the age I've got it. That's the age I've got it. I'm a little bit older than that now. So yeah,
It's hard.
that's when it's. I didn't understand why it happened to me at the time, and it took me quite a long time to accept it. But now I do accept it. I'm trying to learn a bit more, and through these FND waves, you're learning. We're all learning with each other and getting on with, you know, what we can do, what we can manage, and help each other out. So that's the best thing about this group. Is anything else we'd like to ask?
I think there's so much. I think there's so much, and I think just listening to everybody's stories and how they sort of, you know, deal with their symptoms and their, you know, their strategies on things is becoming really helpful. I mean, unfortunately, I get quite a lot of the symptoms, and at times I resemble as if I've had a stroke. So I have complete loss of sensation on my right side, and from my waist down, I don't feel like it's my own anymore. So it affects my bladder and my bowels and everything. I can't move my right leg. So it's it's
well,
everything really.
because FND is basically affects your brain, your nervous system, your guts. So it just basically the whole body.
Just everything.
Yeah, everything. Yeah, and it's not easy. Like when you got the job for so long that you work for, and then you lose it.
I did, because I bought myself a new house. I had my perfect job. Everything was going fantastic. And then, you know, it was like a split second, and trying to explain it to my 11-year-old son, what's happened and how life's changed, not just for me, but for him, you know, my partner and my partner's son and my parents. It's still new, not only for me to accept, but I think for the whole family to accept.
Yeah, it takes time for the family to accept. Children is the hardest to accept it, because it's hard with my children at first, because they were so young, and it's the same. We're about the same age as your children. So now they've accepted it. They're trying to accept it, but they're still not understanding it. That's the issue, even though they're grown now. So so don't worry, it takes time.
I'm sure I'll get there.
Yeah, you'll get that. Don't worry. Okay.
Patience. That's all you gotta have, is a lot of patience. I've had mine for over 30 years, and they finally diagnosed me in 2017. And it was off and on for, I had 10-year spans of nothing. And then all of a sudden at the 10-year mark, I'd have a episode. And it was like a stroke-like symptom. My left side would go numb. I'd walk. I couldn't talk. It was awful. And I read that book, The Power of Now, and that got me through a lot. Like I accepted it, and I'm like, okay, now I can start living my life, you know. And a lot of symptoms have subsided. They're not as often. So that's even a blessing. And then with you guys, it even helped more. So to me, I feel like I'm normal, but I'm not. But I feel like it.
What is normal though?
No,
This
is normal. We're all normal.
We're normal.
We're all normal.
This is actually the new norm.
Yeah.
This is the new norm.
You have to laugh about it. You really have to laugh about it. It's scary, but it's part of life now.
A sense of humor, and you'll be all right. Otherwise, we can't be letting us down all the time, because that's just going to affect our body. So so we have to try and think positive, and hopefully and try to think about the present time, and not think about what's happened in the past, and what's the reason.
You know what? And that's a work in progress. And I say that I have made strides after reading that, but I still, like, today was a very, for some reason, something within me still felt very like there's some sort of emotional something, but I wasn't necessarily thinking of past things or future worries or anything, but I just had a stirring of, you know, an emotional doubtness. And I, you know, I just would go into the practice, like my meditate. And there's the great thing about doing this, first of all, with us being accountable and being a group together, that we support each other and encourage each other to keep doing that and find your specific guide, because I know for me, I needed like a guided meditation because I couldn't get to that meditation on my own. So there's a
Yeah.
host look for on YouTube, look through your apps, the app store, whatever app store you use. Look for free, make sure they're free. I mean, no sense in us paying for anything extra we don't need to pay for. And that's what I'm trying to do with you guys too, by
of meditation
reading.
on YouTube, and you can get them. There's an app actually. I will put it on a group, and that is free. And I'll put that on there, which I've learnt to use, and it helps out. So
And that's what I want the whole group. That's exactly what I want the whole group to do, because when I go through the group periodically and get caught up, I see comments on posts that even the comments can get overlooked that are very valuable information. So I'll quickly type out to that person, please put this as a post, make it clear out there. This is a very helpful, view or information or whatever it is that they were sharing. I'm like, oh, please post this. Don't just make it hidden in these comment sections, because some people overlook that stuff. So we welcome any resources, any ideas, any thoughts, any questions, because that's how everybody learns, is by bouncing all of this from each other, taking insight from each other, and then, putting it into our own ways that we learn, the ways that we grow, the ways that we instill, our value systems, our belief systems, all of that. And so that's another thing I wanted, like, I use a different app. So what we all can do is just share what we're using to get to that meditative state. So go ahead, if you have one, Emily, Molly, Brandy, Mitchell, Julie, B, or anybody else in the group, please put a link, or even if it's a screenshot of that you use on your phone, if it's a screenshot.
I will send it out to you guys. Put it on the post. It's a website. It's not actually an app. It can be an app if you want it, but I prefer to be the website, which is free. So I'll send that out to you, because that's something that I learned through energy management to help me with meditation, to learn a bit more and open up spiritually. That's what it's supposed to be doing, and it's helped out so much and helped me to look for you. So yeah, so it's been great. I've learned quite a lot from everybody, really. There's more information within this group than I find other groups. So I've noticed that there's more information. I've been going through every group, to see, but we have become like the biggest one out of the groups.
Well, part of it is because I believe in transparency. I believe in not such strong-holded regulations that we aren't able to speak.
Yeah.
But at the same time, which I've noticed, and I've had to make comments this week and a couple of posts, because I've had a few people reach out to me privately saying, I tried to post this, or I tried to make a comment on this, but it was denied. And I'm like, oh, well, actually, this week we had an admin meeting and we're getting really fed up with the spammers, and we're trying to protect the whole group of spammers. So we kind of tightened it a little bit, because Facebook has settings where you can go and put keywords so that if a post or comment comes, it can deny that. And so we've kind of used those keywords, and I just kind of that's why I posted that in the group today. I think it was this morning.
Yeah, I saw that.
This is what's going on. We're having these are the keywords. So if you do run across research, like the one gal was telling me, she actually ran across research, and in her post, the keyword that she used was I can't say it. Psilocybin? Is that the word? PS what? Psilocybin?
Oh yeah, that one. I
Placebo?
don't remember what it is.
Placebo?
No, psilocybin.
No.
Like the microdosing mushroom things. But the word is actually
psychedelic.
called. Well, she used.
Psychedelic?
Hold on, let me tell you the two words.
I think it's one of those words that kept me popping up.
Mm.
How do you spell that, April?
I'm getting there. Hold on.
Okay.
Rolaids. ROLAIDS. Relief.
Right, Mitchell.
You remember that commercial?
I don't think you can go fast enough. You should go a little faster. Hey, you want to try that again? P what? Slow.
PSY.
Go slow. Say what?
PSY. Let me type it.
PSY. Okay.
PSY psilocybin. I think that's the way. Oh, nope. I'm going to make sure I get it right. How do you
So
spell
PSY.
psilocybin?
Psilocybin.
Oh, it's called psilocybin.
Psilocybin.
P-S-I-L-O-C-Y-B-I.
Okay, thanks, Siri. PSILI.
Love that.
So, and what is that?
It's
No,
a mushroom, basically, and needless to say, it's a mushroom. So actually, there is great research that there are and I'm all about holistic, approaches, and there are mushrooms. They found research in mushrooms. There's a lot of things out there that have research on that are good for you. But at the same time, the one thing that we had a discussion in our admin meeting is that some of the things is these spammers that copy paste, hey, go reach out to Doc Nelson Heals or da 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 da.
Oh yeah.
You buy in capsules. How do you know what's in those capsules? Those aren't governed and regulated by the FDA. You don't know what's actually added into it. And I can only speak for Americans at this time, and I'm not sure if it's continuous at the same time in other countries, but due to a host of situations in America, fentanyl has been brought into the United States enough to kill all United States citizens. So it can be laced in anything. And there's been children, we've lost children because fentanyl was in a candy wrapper and the kid licked it, killed the child.
God.
Things are like, this is like out of control and rampant. And
we don't
so
want that. That's the thing.
I try to just avoid, okay, here's an example. I did a lot of research and saw that there is huge benefits in the purple sea moss. Now, when I went to go research and buy the sea moss, I saw that you can buy it in its true form, but dried.
No, the Irish sea moss is actually better, and I know that because that's what in our culture use. So I know that's good.
Yeah. Oh well, ours is Jamaican or Caribbean sea moss because it's closer to us. So
yeah, the Jamaican side. Yeah, it's
the Caribbean sea moss is where I've been getting mine.
But we can't promote. That's the thing.
You call it what?
We can't promote it here to say, yeah, you could take that, can we? Because we'll be.
You can't promote it.
I don't know.
I'm not promoting it. I'm not saying, hey, go do this. I'm saying, take it, the research, look into it, talk to your doctor. I went and did it without talking to a doctor. Why? Because I have the freedom to be able to do that, and I'm not going to, it's a food source.
Yeah,
it's food. It's not like, so what I did was I actually bought the dried sea moss and I attempted, but I'm gonna warn you, you better get the recipe down, because if you go and attempt to make the gel yourself, I might as well have licked a jellyfish. It was and to choke it down was just god awful. And I realized that there was tricks in making it to make it not so fishy, slimy, disgusting. Oh, it's so gross. And it just literally tasted like I just picked up a dead fish from the sea. Ugh. So and I love seafood, but that was so bad. That was so bad.
Sorry, that's too funny, April.
So I could also, from this company I was buying it from, I could also buy the already made gel form, or you can get it in powdered form. You could get it in whatever form you want, but make sure you're really reading ingredients,
Yeah.
what's really in there, and know that you trust the source you're purchasing things from. You read your reviews, and this is the part I promote. Do your research, read your reviews, talk to your doctor, but share different approaches of things that we've done. It's okay to do that in our group. And
So where
and
do-
for B, like I said, you can promote Manuka honey, the sea
That is-
moss in my
yeah.
group. You can promote it because I'm not banning that. Just make sure you always state, like the little disclaimer part, do
Okay.
your research, read the reviews, and
Okay.
talk to your doctor about it. And that's all the disclaimer you need. And that's what we
Where
have.
do
Like,
you get this stuff from?
knew you were going to ask me that.
Well, I have no idea where to read a book or something like that.
I'm in the UK, you could get that anywhere. So it's all right.
Oh, really?
Yeah.
Okay, well, I'm in
Yeah.
Canada, so I have no idea.
Yeah.
I'm thinking, like, what, a health food store?
Well,
Yeah.
I ordered mine. I
Yeah.
personally ordered mine.
Okay.
You could go for Amazon if you want
Holistic
to.
Vibes is
Right.
one of the companies, and so
Okay.
Holistic Vibes. If you're hearing this on YouTube, please promote us. Help promote this, and support our channel to help create income to develop an FND W.A.V.E.S support group and nonprofit organization. So yeah, it's called Holistic Vibes, and they spell vibes VYBEZ.
VYBEZ. Sorry.
Right.
EZ. Okay, got it.
Yeah.
Okay.
Vibes.
Okay. I'm gonna look for that. I'm gonna go to the health food store and I'm gonna check on it, see if they have it.
Yeah.
They're probably gonna look
They
at me and
probably
go, "What?"
could. Yeah, I don't
Do you
I
know-
don't have the access to get out and about as much as some
I think
people
Mitchell
do. So
knows
I just
something.
do a
Do
lot
you
of
know
ordering.
anything
What?
that we're talking about? No, Mitchell. I'm just talking to
Oh.
Mitchell to get. Yeah.
Yeah, I just had a question. Has anyone had any success with CBD oil at all?
I have.
Tried it, but didn't work for me.
Oh, okay.
I have attempted, and
No
if you're
harm in
talking about like oil to rub onto areas, that's the only time I felt any kind of relief. If it's like a muscular rub in that fashion, but not as
okay.
drops. The drops did not
Like
help me
drops.
ingest.
Oh, okay. Okay. I just thought I might try it. That was all.
Yeah, it might work for you.
Everybody's different.
Yeah.
Yeah.
Everybody's
yeah, you're
different.
right. Yeah. Yeah.
Yeah.
Absolutely.
So just
No,
know, just taking that into consideration, it may or may not work, but it's okay to try if your doctor,
Mhm.
if it's okay, and
Okay.
I'm not promoting anything illegal either. So if it's okay in your area, go right for it.
Yeah. Okay.
So
Kind of
what I
what's-
do is I what was that? I missed that. What you said.
What I said?
No, Bell.
Oh, okay.
Oh, I said it depends what state you are, if they allow it.
Right.
So that's
Right.
Country, state, whatever, exactly.
So I'm in Canada, and marijuana is legal, obviously. And
Same here for-
what I have now is that I have a vape, and it's got CBD in it and THC. And I use that when I'm having my episode. And as soon as I take one puff, I'm as normal as can be. Like, I'm walking, I'm talking, I'm doing everything normal.
Oh,
Like
wow.
that's exactly what my husband said when he saw me, because I was all discombobulated and everything. And I said, give me something, give me that. And I took one puff, and within seconds, I swear seconds, I stood up straight, and I'm like, so what's going on? What are we doing? And I said, let's go for a walk. And he looks at me and he goes, what? I said, what? And everything was normal. It was crazy. That worked for me. So who
Okay.
knows if it works for anybody else, but I tried
You know
it.
what? Let me add to that, Julie.
Sure.
I'm going to have to agree with her as far as where I'm located, you can get a medical marijuana THC and CBD. And
Right.
that was a new journey for me. I did it for a year just to see if it was going to help.
Mhm.
And yes, when I did the combination, the doctor recommended me to do the combination one, not just straight THC and not just CBD, but the combination.
Right.
Mhm.
And I did. The vape pen did immediately stop all tremors and tics. However, for me, I had such extreme exhaustive side effects that I didn't like that feeling that lasted for so long. And so that
Yeah.
wasn't just something I was seeking. So just take that to note.
Right.
And, you know,
Good.
if you
Mhm.
try
Yes.
it, you know, there is those kinds of side effects. And
So
you
the
know, find
so
what
the
works for
lingering
you.
effect of the THC is going to stay with you because it's got THC in it.
Right.
I tried just the straight oil, and the oil did nothing for me with just the CBD in it, and it did nothing for me. But once the THC was added to it, I was fine. But I do have the lingering. I guess I'm high. I guess I'm stoned, and
So you
I get and
vape?
I can't drive, and I don't go anywhere. I just stay home and I just watch a movie and I just veg, and I'm good with that. And I'm good, or I'll start cleaning, I'll start doing something. It depends. But yeah, so you get that lingering effect. That's right. Yeah. See, I'm so used to it now, I forget about that.
Mhm.
Yeah.
Yeah,
Try
and
whatever
as-
works for you.
Yeah, exactly. And that's what we're here to share, those ideas, and how, you know, we want to make sure we educate how they, you know, what if there were any side effects or
Yeah.
of that,
Mhm.
and also make sure it's legal.
Yes.
And make sure
Yes.
it's legal
Yes.
where you're located.
Yes. Do not try. Yeah, and don't drive at all. Please don't. Please
Right.
don't.
No.
Don't.
No.
Okay.
You
Stay
have
home.
to do that. That's like taking a muscle relaxer times 10 and then jumping in the car. Not
Yeah,
gonna happen.
that's right. Yeah.
Mhm.
Yeah. You got to be really careful of what you're doing. You know, especially, you know, if you try, and if you do try it with with THC in it, take a small amount, like a small puff, like a very small puff, and work your
Yes.
way up if it's working for you. Don't just all of a sudden take a big puff, because then you'll just be off your rocker. So
Oh,
that's another thing
Okay.
to consider.
so true.
Yes.
All
Yeah.
right.
The
Yeah.
gummies,
Okay.
be very careful with the gummies because they usually come in like 10 milligrams. And when you are seeing a doctor for a prescription, like I did for my case, it's like, okay, it's not written like prescriptions like we typically know prescriptions to be written. It's just like, here, you now have your card. You can go buy this. You can buy X amount of containers per month. And so having no background knowledge whatsoever or experience whatsoever,
Oh,
I went and bought the thing, and in 10 milligrams, I'm thinking, oh, 10 milligrams. I take 10 milligrams of whatever my Clonopin or whatever. No, that's 1 milligram. Take 1 milligram of that. But so you think in my head's thinking, oh, 10 milligrams is nothing. So I chomped into almost a whole gummy. Woo! I was out for days. Days. And it was like, whoa, that is no bueno. And so it kind of reminds me of the little, if you remember Alice in Wonderland, when she ate the tiny little bit of cake and had to take just a nibble, otherwise she'd grow too fast.
right.
That's
Yeah.
what it reminded
So
me of.
small increments, very small, very
Yes.
small, and work your way up, and give yourself about an hour or two also for the effect to happen. If it doesn't happen, just, you know, give yourself time. Put it this way, time is your friend. That's all I gotta say. Time is your friend right now, because there's nothing else you can do, right? Like for the both of you, for Emily and Mitchell, like you guys are new to this.
Yeah.
So time is your friend, and you have to make sure that you don't rush into trying to get better. Don't think that, oh, okay, well, I'll be better in this amount of time. I'll be better in that amount of time. No, don't think like that. Just take it day by day, because you don't
Yeah.
know what tomorrow is going to be. You know,
And when
you have no idea.
Yeah.
And I honestly, I've had this for 5 years. I know that Julie's had it way longer than most of us here, but 5
Mhm.
years. When I went
Yeah.
into this, for 2 years. My first 2 years, I had to learn how to accept it. I wish I would have been smarter to read this book before, because in the last 30 days, my life has transformed tremendously. Just because I read this book and started practicing daily. It has changed tremendously. And I can't stress enough that one thing I noticed in other groups that I had been in, not a lot of people talked about the steps to getting better. Not, oh, go seek this therapist, but there's like, it's like stages of grief. There's like steps of acceptance. And you've got to learn to accept it. Accept this now. That's like the first step to recovery of almost anything, is accepting your now condition and moving from there forward in trying to eliminate it. I know I had a host of past pain bodies, what Eckhart Tolle says, that develops your mind thought pattern of the ego. And the hardest part of my journey on this is that I'm a very loyal person. And I had to, it was a very difficult journey to leave some relationships that caused past pain body triggers, because I'm loyal. And so that loyalty, there was I had to do a separation of that and realize, wait a minute. And, and as I read through the whole book, it helped guide me. And like I said, I read this. It's in our group, in the guides. You can listen to my annoying voice because I'll talk on and on and on. Or you can go onto YouTube and listen to Eckhart Tolle himself, who's got a phenomenal soothing voice. However, when I did that, it was so soothing that I never read it or never got through the whole book. I fell asleep all the time. So I couldn't, I couldn't grasp what I was reading. His voice was so soothing, but Bella's too. I would not be able to hear this from Bella reading to me. I've always told her that. Your voice is just so, I just love it. But I hope to be able to see you on here more, Mitchell and Emily.
Yeah, for sure.
That's just the
definitely.
whole. And when I got this started and we had the set times, I'm still flexible at times because I have people lined up to do therapeutic activities till I think the 1st or 2nd week of August. And some of the hey, that's bad. Sorry. I think both of them are in Australia. So I'm going to have to change the time to accommodate them. So, if you're over here in the US or Canada, it might be the wee hours of the morning when it's actually live going on, but I will record it and post those because it's in our guides. The only one I don't have in guides, which I still need to fix, is Molly's. Something happened on the technological end of the Zoom meeting where they couldn't host it or they couldn't save it. So I fixed that complication. So it should be saved if I get in there or not, if I can join or not. And then I can pull it out of my cloud and post it into the group and the guides. B had sent me, she had to send me chunks of that video. So I have to re-chunk it together in an editing program. And my daughter's here this week and school's around the corner. And this is the first time she'll be going back to school. And maybe that's where my tears are coming from.
Maybe.
I think that's where they're coming from. So I guess I'm having a little anxiety about that. And I want to spend as much time as I can with her. So forgive my delay in getting some of these things in there. You can yell at the other admins for it. I'm just kidding. I totally just
April,
we're just kidding.
April, you're giving advice and you're not taking your own.
I know.
Yeah.
Yeah,
that's what sometimes happens, doesn't it?
It does. It really does.
Yeah.
Well, no, but I did tell our admins when we had our meeting that I will only get in the Zooms one time a week when my daughter is with me, which is tonight because I have her, but she fell asleep because she's been struggling sleeping. So she decided it was necessary to wake mommy up multiple times through the night. So I'm talking deliriously in my sleep or subconscious sleep or something to try to guide her to sleep. And she's sometimes I heard her say, Mom, I don't even know what you're saying. And I'm going, do I even know what I'm saying?
Ah, that's funny.
But it was like till 3 a.m. She was up till 3 a.m. and I'm like, child, go to
What
sleep.
time is it in New Zealand right now?
It's 11:48 a.m.
Oh, so you're the same time as UK. Okay, that's fine. Is it
Yeah.
UK's an hour
No, he said
ahead. So,
a.m.
AM?
It's
Oh,
a.m.
a.m.
yeah,
He's
so
like
we're quite
12 hours or
behind that.
something from you.
we are
Must be something like that.
12:49 a.m. I am
Yeah.
as well.
Wait,
Oh.
so wait.
But
Wait, New
Thursday here.
Zealand?
Yeah, we're the same time. Even Emily, you're in UK as well, isn't it? So
Yeah.
we're 12:49. So yeah, we're all
Oh,
in the same time zone.
No, I think he said 11:49 a.m.
yeah, that's right. 11:49
Okay.
a.m.
He's 11 hours ahead of you.
Oh, okay.
Yeah,
Alright,
isn't that
okay.
crazy?
I have to think about the time zone. Yeah, I have to think about it. Oh, okay.
Yeah.
All right. So
Okay, if it's
Wow, that's crazy.
11:49, it's 7. It is 7:49 p.m. my time.
And my time also,
That's what I thought.
because we're in the time
we're
zone.
after midnight.
I thought so. And I think
Yeah.
Molly is and whatever, but so
Hmm.
brain fart.
Oh, I didn't know you knew that. That's funny. I love it.
Oh no.
Brain
Like I
fart.
was gonna say something. I totally didn't even know
But
what I
that's a
was
good
saying.
thing.
No,
That's
yeah.
a good thing. We need to have brain farts because we got to get our brain started again, right? You know, there's an air in there, a little bit of air.
Right.
Go poof.
Right. Yeah, it needs to go poof.
Yes,
What
yes,
part
and
of
that's
New Zealand
fine.
did you come from? Sorry, because I'm trying to put it in the time zone so it's like it works out so I can do it.
Oh my goodness. You know, my daughter taught me yesterday or 2 days ago. She's like, Mom, if you get into your phone and you go to the clock,
Mhm.
you click on the
That's
world
right.
clock, you can add all your friends all across the world, their time zone on there. And I'm like,
That's what I'm trying to do.
Yes,
I've got
yes, you
that's up,
can.
so I know where everybody is. So
Hmm.
the things kids know these days. I'm like, you gotta be kidding
That's
me.
clever.
Yeah,
Yeah.
that's what I thought. So I do have everybody. I went through our list and went
Yeah.
and typed in all of the countries that I have in my group and put it in my
Depends which
thing.
Wow.
So I always
the thing,
like,
which
aha.
family state you're from.
Yeah, that
That's
helps.
beautiful. That's beautiful. I love it. It's nice to be able to talk to people around the world.
Yeah, that's
Isn't that
what
cool?
I've got because I've got quite a lot.
Yeah.
People to talk
Yeah,
to.
that's cool.
That's so exciting. And I remember my friend and I, we used to talk on the phone for, I don't know, 10, 11, 12 hours, you know, when we were raising our kids at a time. And we both thought that, boy, wouldn't it be nice just to sit here and just talk on like a phone with the TV? And this is what we're doing.
Like the old, like, yeah, exactly. And now we are doing that.
And now
Do you
we
remember
are
the-
doing it.
Do you see this
Yeah.
picture? Do you remember those days?
Yes, the contemporary phone.
I
Yeah.
sent that picture to my sisters and I said, oh my gosh, that's why we all have bad necks. Do you remember?
Yes.
Stretching
Yes.
across the house with the
Yeah.
cord and twirling it
Yeah.
around and doing and I'm like, oh, that is why our neck is so bad. Pretty sure.
So true, eh? Yeah. That and the rotary phone. That's why
Oh,
that's
gosh,
why my
yeah.
fingers are so
My
bad.
grandmother had one forever.
Yeah.
I'm like, Grandma,
Yeah.
how does this work?
Oh yeah,
I'm
that's funny. I
we
love
don't
it.
have
Okay, guys, I'm gonna go because I'm gonna go watch a movie now with my husband. And
likely.
you all take care, and I shall see you very soon.
All
All
right.
right.
I'm,
We
I'm
got
gonna
the
go
room.
too.
Care.
Bye, guys.
It's gonna get loud
Okay.
and crazy
All
here
right.
because
See you later.
bye-bye,
Bye.
Julie.
Okay.
Bye bye.
Bye,
Yeah,
Emily.
Julie.
Bye bye.
Bye.
See you later.
I'll send back messages. Okay.
It's going to
Bye.
be really
Yeah, I'm
loud
gonna
and
go.
crazy here too, because we got the Republican National Conference going on and my family's out there watching it, and it's going to be very loud.
Oh, wow. Okay. Good
This
luck.
is
Enjoy.
yeah, right.
Yeah.
I can already hear him hooting.
Everybody's like really interested in this politics thing. So,
Well, this is like stuff is going down, like worse than it's ever gone down in the US.
yeah.
And it's just so many issues going on. This like the worst in
Now,
history
when is the
ever.
final vote for you guys?
November 5th is the election day.
Why so early? Okay. All right. I'm not gonna question
I know,
it.
but you know what? They always do in November. I think it's on a Tuesday. So if the 5th is a Tuesday.
Yeah.
And then they have to take months of integrating if they have a new president coming to office. So they have to kind of integrate and slowly
Mhm.
turn over and hand over the position to the next president coming through. So that's why inauguration doesn't happen until January, I believe. So they need that time of transition that happens. But
Okay.
we all I'm asking for is prayers for this because things are pretty darn scary. And I mean, I know it is all across the world. I've been praying for everybody in the world because I know it's really ever since COVID, it seems like
I've
everything's
noticed.
been held,
Yes.
you know?
Whoever's
That
the president
lockdown,
is the one that's going to be in charge of everything. So we
the
need to know.
lockdown caused such
Mm.
lots of different just it made people irritable. It's hardening the economy. Just that situation in a nutshell, and if you think that what we went through with this pandemic, imagine back when they had the Black Plague and when they were poor and it wasn't like they didn't have access to spread the word fast enough to shut things down fast enough, or you know what I'm saying? Like, imagine being in an era like that and having a pandemic.
Actually, there have been countryside in Africa. They don't have that. So
Right.
didn't know about COVID and it never got COVID at that places. So
COVID never reached them
no,
unless
it
people
didn't reach.
traveled to them and brought it to them.
Unless they stopped the airports. Nope, they didn't get them. So
That's
that's the
awesome.
thing.
Yeah, because there's so much travel. That's what caused a mass spread of it because we were in
Yeah.
a fast-paced,
everyone was
moving,
traveling.
constant.
Yeah.
Right.
Right, guys, I'm
Ooh.
gonna go. I'll see you all soon.
Cool.
Thank you so much for
All right.
tonight.
It was so nice to
I'll
meet
see
you,
you
Emily.
again.
Thank you for
See
joining.
you.
See you, Emily.
Bye.
Bye.
Bye. But yeah,
Oh,
that as I have done lots of research and heard lots of different things, and we can't say certain things because of the certain platforms will shut you down. But I want to say that I think just the pandemic, everything involved in the pandemic itself had enough emotional trauma for everybody to deal with in various sorts of ways. That's probably one of the big reasons why we see a big escalation.
It's the social anxiety of it.
That too. So that's
That's-
probably why we see a huge increase in the amount of diagnoses.
Yeah, that's what I think it is.
Because there were so many. If you take every situation, oh my gosh, what if a family member could have gotten sick and died? You have medical possible trauma because you got sick yourself, and hospitals are overstaffed or understaffed and overworked and packed to the hilt. So maybe you're not getting the adequate treatment and care that you needed. So there, you could have medical trauma going on during this pandemic. Pushing.
Dr. Yadira said it's the environment that
Exactly. So if you go around the entire thing, it doesn't matter what our environment was at the situation. it could have triggered that event to escalate for everybody because there was such a drastic change in the world because of the pandemic.
Mm. Mm.
It affected
True.
everybody. If you think about it, it affected everybody to some degree. To some degree, it had an effect, and whether it be whether you were running a business and that had to be shut down, then it's going to be an economical impact. Your financially, our ability to access toilet paper, need to get toilet paper, going into a store and seeing there's hardly anything in there. That becomes, that's kind of scary, you know? So if the whole pandemic itself had to have effects on everybody globally in some sort of way. So
Yeah, it has. It definitely caused social anxiety for definitely me. It did cause me a lot.
me too, but I was glad that I was glad I had FND because I was using that as my excuse not to go out.
Me too.
Like, nah, I don't want to have a seizure in public. You don't need to take me out. I'll stay right here. And then you that becomes a pattern though. And so then I had to learn how to break free from that when I started feeling and reading, okay, it's not as bad as it really is. And it's okay to go out without a mask and all these things. I've had COVID twice now. It's no different than having the flu.
I had it about 3 times and I'm okay. So, because obviously all the symptoms that we have, it you know, it battles it. So it doesn't matter.
I'm sitting in such a position.
Especially when you have autoimmune. Yeah, you've got to battle with it. So yeah. So you'll get it because it happened to you, Mitchell, and I've just got it like the last 2 years. I'm trying to understand it, and I had FND beforehand, so
so I've never had COVID, but I got my autoimmune diseases from the vaccine itself.
Oh, okay, okay.
I've heard that from many people, many members. Actually, I have heard that.
Yeah.
So I got it from the booster.
It happens, yeah, it does happen.
Yeah, so I got it from the booster shot about 2.5 years ago.
I had a friend that had
battling ever since.
that from a flu one, and yeah, it's not fun. And so, did they give you a diagnosis of what was my friend has Guillain-Barré syndrome? Because Guillain-Barré is the autoimmune disorder that truly shows up in an autoimmune panel test.
Yeah.
At least in the United States. There's a panel, an autoimmune panel blood test. And it shows up that the antibodies, your immune system antibodies, are not fighting correctly, and they're actually attacking different types of cells. And for Guillain-Barré, it attacks your nerve cells. My friend has shaky hand, like very jittery hand. And if she gets the flu shot back in 1970 something caused it for her, so she can no longer have any vaccinations. And if she gets sick with any of these viruses, it can put her in the hospital, making her have to have these IV infusion treatments. And I cannot remember the medication she has, but it will actually cause permanent paralysis, slowly up her legs all the way up to her neck, if not caught in time. Yeah. And I know two people.
Terrifying.
I know two people that it's diagnosed as that Guillain-Barré.
Yeah, because I've got lupus. Have you heard of lupus before? So
I've been tested for it, but
so you're chronic fatigue more. Yeah. So I know
fatigue, and I got fibromyalgia. And I've also got POTS as well.
Okay, yeah. So under the umbrella, they put that in. So so it's part of it.
So
hello, Jocelyn. Welcome.
Yeah, welcome to the group.
Hi, I'm in the car and my kids are throwing a fit in the background, so I'll probably stay on mute.
Okay, that's fine. If you
That's
if you
cool.
need us, just unmute and jump in.
Sorry, the lights affects
Awesome,
me
thank
sometimes. So I have to
you.
turn it on.
Yeah.
So it was interesting to hear what she had to say, her take, the doctor's take on this, because it's basically all the stuff I've been thinking about FND from since I've gotten it and contemplating
Yeah.
everything. And it was just like FND is the umbrella term for many dysfunctional different disorders. Do we want to really call them disorders? Why can't we just call them symptoms? Because then you're going to have labels for every single disorder. And then I go to a doctor and say, hey, guess what? I have dysfunctional bowel. I have dysfunctional bladder. I have dysfunctional gait. I have dysfunctional speech. I have dysfunctional. Do I want to go with that list?
No.
I
No.
should have
That's
asked
why
that
under
question.
this thing. That's why they put it on this umbrella thing, so that way they know you got those symptoms, but they don't know
But not everybody does. That's the
what
thing.
else. Not
Yeah, it's
what
all
else.
different.
That's the
So
thing.
what do you, okay, if that's the case, my mom has IBS. That is under FND. But that's all she has.
I had IBS before all of this started. I had
But
it
that's
when
all she has.
exactly.
Come back.
So it would be fair to say, truly, technically, based on what Dr. V said, my mom has FND and IBS. She has the IBS only form of FND. Is that clarifying that correctly?
The way I've understood it is like whatever symptoms you've been diagnosed with, you could probably have FND as well. If you have FND, you'll be diagnosed with something else as well. That's what's it's like
Yeah.
a circle, basically. That's how the way I understood it. It's like a vicious circle. So if you could have FND, something else to go with it. Like FND was autoimmune. Autoimmune is quite a whole bunch of different hundreds.
Autoimmune. Yeah, that affects different
Oh, yeah.
different body
Yeah.
organ systems. I get what you're saying. Yeah.
Exactly. Yeah, there's difference. And you don't know which one you have until they find out that is. So right
You know
now,
what I really,
I'm in limbo kind of thing because I
you know
don't know
what I
which
really
one I
liked
am.
about her? She's probably
Yeah.
one of the first and only doctors I've actually truly met
Mm-hmm.
that doesn't speak just medicine,
No,
that
that's
talks
what I
about
like.
spirituality. Medicine, you know, is scientific, it's proven scientific. For them to bring in spirituality into it is a difficult challenge when you've got a scientific mind, but also a spiritual mind. You have to be, it takes a special person to welcome both
Yeah,
types of
she
things.
her spirituality, from what I've learned, is the sharp.
Yeah.
I can't say the word, which is a Native American way of believing. Is spiritually. That's her way of believing, and I find it very interesting. And that's how other people's faith is. So, whatever faith you have, whatever belief you have, is to do with spirituality. So, yeah, it's hope at the end of the day. That's the way I see it.
Basically. Yeah.
Yeah.
Sorry.
Yeah.
That's
The
bad.
dog.
I lost you guys for a minute. My dog ran across the keyboard.
Yeah. So basically, the way I understood it, it's all about hope and belief. So it doesn't matter what faith you have. It doesn't matter what you believe. It's all about faith and hope, and that's what she was saying. Something else she was saying. I can't remember. But otherwise, she was brilliant. I find her more. She understood the patients more than other neurologists would do. Sorry,
Right.
but that's how I see it.
Right. But she also realized she took time away from patients to be able to get to that point, to spend the time studying it more. So she no longer practices with patients anymore. She does this research.
She actually does research and educates people with FND. She's actually, I'll link up her
Please.
website.
I don't know her. Stop.
Yeah,
Bobby. Stop.
no, I'm on it, on her was
That's
her. So
her.
that's how I found her, and I thought, oh, she's actually an interesting neurologist. But I will find some more. Don't worry. But I find her very down to earth. Don't worry. She's very down to earth. That's what I liked about her, because she could explain a bit more than this neurologist giving us these terms.
Mhm.
I just want them to be. She's more compassionate than the other people are. That's what I wanted someone to hear
That's what I
us.
really, really liked it too, because she
Mhm.
listened. She took the time to
Mhm.
listen.
Yeah,
And
that's
truly, and she also admitted when she made it, when Julie's question, I loved it.
yeah.
Julie's like, what's the difference between
When she
disorder
tricked
and
her.
disease? And she's like, well, you put me on the spot all over live face YouTube. But it was like, you're human and it's okay. And I like that because uh the you see nowadays so many doctors seem to have like one, it like I stopped for a while and I have to try to imagine myself in their shoes. Why would a doctor become a doctor? To help people.
Mm.
Why else would you become a doctor? Why would you spend that many years going to school? To help people, right? You obviously have a
Exactly.
desire.
I think.
That's not always the case, though. There's so many
Mm,
doctors that don't care about patient care. I before I got sick, that was my goal, was to go to med school, and there was quite a
mm,
few people that I met that were in the same line, that you would be shocked that there's so many in healthcare that do not care.
mhm.
And
That's
this
true.
is where I'm going. This is where I'm going with this. Because because I feel the same way you do many, 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 many times, Jocelyn.
Mm,
But I have to separate myself as not the patient, as an outsider looking in. And I do it through observing and seeing, especially with my one that I have to see more frequently, like my PCP. And I notice he's quite busy every time I'm there, always running an hour behind, short-staffed, always short-staffed. And he works for the hospital system, so it's not like he's a private practice. And
mm.
so he's not being assisted appropriately through our hospital system.
The PCP, like I said, PCP,
Primary care physician,
well, basically GP
GP,
yeah.
yes. That's the way
So
it used to be here.
they
But they
are
switched.
they are very overwhelmed to follow the protocol of these paperworks, and are not thinking about patients and well-being. And they
Mm-mm.
try their best. Some GPs do try their best. Like my GP tries her best to understand, and I'm teaching them about FND because they don't have anybody who's got FND in their surgery. So
That's how mine was too.
so it's like I'm teaching them what's going on with me and the other symptoms that's happening, and they're trying to understand it by going through these websites like FND Hope.
It's hard for them to do that when you give them that much information and they don't have the time.
Actually, I know the symptoms, so I know how I feel. So you have to listen to what I feel, not what it says on there. So
Right.
you have to advocate yourself and actually say it. And if you don't like it, go get a second opinion, the
Which
different
is what I'm
doctor.
doing now, because yes,
Like,
after
yeah,
having my primary
I
care
mean,
for
like the neurologist I had with previously changed over, and they're the one who confirmed it to me and said,
right.
"Well, you got FND," and I said, "What's FND? I've never heard of it." So yeah,
Mm.
I've already had 12 neurologists in the last 5 years. 12.
I don't know how many I had.
I
And
stopped I
one
stopped
out of a
seeking
weekend.
out. I
Yeah.
stopped seeking them out because they have not done. And the funny thing is
Mm.
that I've seen a neurologist probably since I've been 25 years old because of car accident with visual neck damage of my bone and my spine, visual.
Mm.
But now all of a sudden that I have an FND label, they can't help me with my spine that was helping me for so many years before. That's one thing that really perturbs me.
Yeah.
It's like, so that's what I'm talking about with Jocelyn. I get, but I have to like, you try to step back, you try to think about this, you try to educate them, give them your resources, this, but they still also don't have the time. And then when they get so frustrated, they don't know what else to do other than throw out their own frustrations at you. And recently this happened to me with my own GP, where they told me I was manipulating. They felt manipulated by my seizures. And I'm like, what? My seizures, I feel manipulated by my own seizures. Are you kidding me? Like, I wish I could stop them. I don't like them. But I no longer, you have to, like she said, advocate yourself. You just go until you find somebody you know is going to listen to you. Take the time to read, even if they you don't have to go to someone that knows about FND, as long as they're ready to walk that journey with you and is willing to learn alongside you and take the information you bring to them.
Yeah.
Right.
Because you would need that support, because otherwise you are lost if you don't have that support system in place. So yeah,
just gotta make sure you find what fits you best, and you know that medical professional is going to work with you, even if they don't know it, but you can sense and tell that they're willing to learn. That's what you want to seek out, because when you get a medical professional that just cuts you off, doesn't want to listen, that just creates more stress, which creates more triggers, and then just as another roller coaster effect. So in this journey, don't think that you have to seek one that really that specializes and knows all about FND. You don't have to, because the knowledge is out there, the research is out there, they have access to it. And if you come to them, you might be helping them learn for a host of people that are coming to them eventually. As long as there are people, a compassionate doctor that's willing to work alongside you.
Yeah.
That's the big key.
Someone who's willing to learn.
That's my heart. That's what I've had a hard time with.
Yeah, it's just like
I actually, in the US, we have to well, for me anyways, I've had to, as I'm trying to find new doctors, I can't just call up a doctor and say, hey, do you take my insurance? Can I make an appointment as a new patient? No, you actually have to call insurance first and say, hey, I want this to be my doctor. They put them down to be your doctor. Then you give the information to the doctor saying, here's my big long form that I filled out for you. I'm going to make an appointment to see you. Then you're testing to see if it's going to be the right fit. I gave my paperwork over a week ago to the doctor, and they said they'll give me a call to make an appointment. I guarantee after they looked at all that nonsense, they're like, heck no, we're not taking her. That sounds like a mess. I'm not willing. I'm putting the brakes on right there. So now I have to go through the process again, going through my insurance, trying to find another doctor, changing it on my insurance, and trying to go to another doctor again. So there's where another issue in the United States, at least, is a challenge that we're facing as well. It is complicated. And it shouldn't be.
What kind of insurance do you have? I get Medicaid and Medicare. I don't know if that makes a difference, but I can call and get the whole list of doctors. And then I usually just, do you have primary, or is that what you're trying to get?
I have Medicare it's in the form of United Healthcare Dual Complete, because I also have Medicaid. Is it?
Yeah, that makes sense. I have Aetna, but where I'm at, I only have two companies that do the dual program. I know it's a pain in the butt. You're limited on choices. I was just asking if you had a, I forgot, primary care doctor.
I did. Up until this June. I actually saw him before I had FND for 10 years. He walked through this journey. He walked with this journey last 5 years with me. The day that I walked into his office after my initial sudden onset and a week stay in the hospital, he came unglued and said, oh my gosh, you need to be in the hospital. And my mom said, if they released her like this with no direction other than follow up with your primary care and a neurologist.
Yep.
And he was like, well, what do I do with this? This is shocking to me. He was just blown away by my condition as I was. And he's very thorough. So he was reading, and he, he's part of the doctor of that hospital system. So he had access to every single test that was ran in the hospital, and still was just blown. And he I give him kudos for what he did do for a while, but seems like over the last year and a half that his patience has worn thin. And maybe it was a bad day, maybe, but I reached out to him like my counselor said to do. I reached out to him, sent him an email, said, your behavior on my last visit was, not professional, unwarranted. Can you explain why you behaved that way? And he called me up, and the words that he said just said to me, no, this is not going to work anymore. No. When he said that he felt manipulated by me having seizures, I'm like,
Doc,
yeah,
I don't think we go back.
I'm like, Doc, I've been with you before FND and since FND. You've been with me along this path. I'm not making this nonsense up. I feel manipulated by my seizures. You're supposed to be helping me with that, And so I'm like, no, I don't, no more, zero tolerance. I gathered enough information and watched him, observed him over the last few visits that it's like, I'm not liking what I'm seeing, the changes I'm seeing. So that's
you don't want a doctor.
Did you
There's
asked,
no point of trying to make something.
Yeah, exactly. Answer your question, Jocelyn. I say, did you fully miss the doctor? You did miss her on here, but guess what? I live streamed to YouTube, and we are live stream right now. I also will say I've also recorded this. I will post it into the group. And I'll post the link to the YouTube as well. And the doctor said she would like to come back in a different. She introduced herself. Basically, you'll see that in the video. She introduced herself and what she's been doing as far as the research and looking for different therapies and whatnot. And she would like to come back in a different fashion, more laid back, like a Q&A form. So
that would, I'll try to get her to come and arrange that when she's free, because she does a lot of researching. So I will try and get her to come back again, one of the Zoom chats.
B has taken on so many things for my group. Hats off to her, man. She's become our group police officer, investigating to make sure we keep spammers and scammers out. She's been reaching out and helping find people to bring into our meetings. That's phenomenal. Thank you.
I know we needed something like that, but we'll need some more as well. But I liked her because she's very compassionate towards patients and understand.
Yeah. FND. I like the fact that she is a big Eckhart Tolle fan herself too. That was helpful. That kind of made me feel like, oh, thank goodness. I mean, I'm not steering them in a, I'm not reading.
Teaching. She does her teaching, and it's very good. I mean, she's on a website called sorry, let me just go, Healing Functional Disorder, and that's where I found her, and it's through, I think it's on a YouTube I found her.
She did say she had a YouTube group. Yes.
Yeah, I found her in the YouTube group. And she went the latest to the conference, the FND conference in Italy, and she could see there's no changes going on with the FND neurologist. And it's like she could tell they're ignoring the patient's well-being kind of thing. So when I saw that and I saw her little, I don't know, TikTok, Instagram, I'm not sure what it is, because I don't have that. I'm too old-fashioned for all that stuff. But when I saw that, and I just liked the energy. So I just thought, you know what? Let me try, get to talk to her, get to know her, and see if she could join us and explain a bit more about it. And
I'm sure I'm glad you did.
Yeah. I'm glad I did that.
And I am so bad because literally before you got on, and like when I just happened to peek in, I literally had like this, didn't even recall what day it was. And then I see in our chats, I'm like, oh,
I know. I almost forgot what date it was today. Sorry, my dates, the days. I have no clue these days.
The worst part of it.
Yeah.
I did an oil treatment in my hair and planned on taking a bath and washing it nice and clean. And then I see in the group Zoom with the doctor, and I'm like, oh, I gotta do something with this mop, this greasy mop I've got going on. And here I am quickly doing this as I'm texting you, going, oh no, I'm gonna go on YouTube like this.
You know what? I had such a fantastic day today. So it's like I did a little bit of meditation and then come to this, and I was like, cool, this is actually I actually enjoyed it. Got to learn a bit more. Yeah, I got to learn a little bit more about FND. And
we've met new people. It's nice to have new people.
Every day I'm learning different things, different symptoms, and different things we're able to do. So yeah, I'm learning. So
different therapies that are very uplifting. Yes.
Yeah, if you don't have,
speaking
you
of,
can't do anything.
So Mitchell, you said you had this for 2 years now, right?
No, I've had FND for about a month.
A month.
Okay.
It's also had for 2 years.
Autoimmune. Okay. So FND. One thing. I'm speaking clearly now, but I don't know if you jumped in early on. My memory is bad. I did have a head injury prior to my FND, which I know FND can also cause memory, but so can my head injury. So there's that stuff going on. But my speech was bad when I jumped on. But over time, it corrected itself because part of that was a mechanism of our focus, our taking our focus and put it into a different, that you no longer have distraction or because you're not focusing then on correcting the speech, you're focusing on something different, and then it fixes, it corrects itself. Yes. Now, with that being said, the only other thing I notice this with a lot of people, and I don't, correct me if I'm wrong, but if you do it as well too. After being on here, cited, talking, blah, 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 I start to sense a sudden, like a decline of great fatigue, enormous amount of fatigue that, like, I just need to rest. And when the thing is when you get the FND, when you're first realizing it, the hardest part about realizing when you get FND initially, I think, is identifying your triggers. And being aware that symptoms can change and morph, right, B? They can kind of morph.
Basically, it's just like a wave, and you just ride it out.
Ride the wave.
And you just ride it out and let it happen, and then it will go away. That's the way I see it.
That's what I've kind of learned as well. You just let it do its thing, and then you just don't know when you're going to come right again. It might be a few hours or a couple of days, and then you'll be okay. And then if it just come back, you just don't know when, though. That's the hardest part.
But that's also a good day. You have a bad day. You just don't know which one is going to be tomorrow. So that's why you have to be present. Stay in the now, in the stillness. That's what you need to be on. So,
and I'm telling you,
absolutely.
The funny thing is, I've heard that for so many years, heard people say it for so many years, and never really understood what it meant until I started practicing it. Didn't understand fully on how to. What do you mean, be now? I am now. I know I'm now. What are you talking about? Be now. Be present. I know I'm present. It's a total changing of the mind. A total changing of that. Get rid of thought. Wipe it out of your head.
Don't make plans by day by day. Don't make plans, because if you make plans, it's just going to spoil it. That's the thing.
I mean,
and it'll,
to a degree. I mean, we make plans all the time, B.
If you plan it, sometimes it'll flare up the triggers. It might.
Well, yeah,
trigger.
but it's okay though. I mean, we've made plans for our Zooms, right? We've got set aside times for our Zooms. But the thing is, you make this, you have a set time for them, and you made that plan for them. But it's tell yourself if you cannot make it, it's okay.
Yeah.
Yeah.
Yeah. So in another sense, like if you create stress, they can also bring on more triggers. So over time, are you trying to introduce more stress triggers, or are you trying to reduce them back to another level so then you don't get the triggers? Or like, you know what I'm trying to say?
You have to learn what triggers you. You have to learn what triggers you.
So
if you don't learn it, it will just happen quite often. But if you know it,
if you're talking specifically like stress ones, or like, because there's a host of different triggers. It can be stress. Mine, let me give you an example for me, and then B can give her examples. Mine can be stress of environmental situations, relationships, blah 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 blah, yada yada, that stuff. The day in, day out life, mental life processes. Pain, extreme temperature changes, heat or cold. So that's, that's not controllable on the external environment, but can be internal in your own home, where you're at there. Be mindful then of the temperature outside and whether you want to go out for a walk. Is it a good idea to do that if that's a trigger for you? Another one is overexertion for me. Low blood sugar. I'm not diabetic yet, and I pray that I don't get that far, but low blood sugar can trigger. But I also Hi. But I also have like what is it that you said, gastroparesis, that you feel full all the time, you just not ever get hungry. So then I forget to eat because of that hunger is not there.
Yeah,
so then that triggers.
Anything still. I would say I was going to eat before I was going to join the Zoom, but I didn't eat. So I still haven't eaten it. It's like I've got no appetite. I know.
I didn't eat either though, so I had a huge lunch, and I'm very full from my lunch. So
I know.
Mitchell, did we answer that question correctly? Hi, Muriel. Hi.
Hello.
She's connecting to audio.
Okay.
Still trying to. I see that still trying to. She's not quite there yet. But Mitchell, did that make sense? Was that answering the question, or were we not understanding your question fully?
Mitchell,
you're on. Mitchell, your mic is muted.
Can you guys hear me now?
Now we hear you. Yes. Hi, Muriel. How are you? Welcome. How are you?
Excited because I finally got to get on and chat with other people like me with FND.
Oh, I'm glad you're excited, and we're glad you're here.
Earlier, I left a little comment in your live chat from my YouTube channel called The Brave Muriel.
Yeah,
okay. I was just saying hi. And my caregiver wouldn't let me earlier because she was praying.
Oh, so you found it through the YouTube, huh?
Yeah, I found you guys through YouTube.
And I've noticed you as well. So yeah.
Oh my word. That's amazing.
Yeah, I'm such a fighter. I always fight with a smile.
Oh,
that's good.
I mean, if you haven't watched my documentary, I have a documentary up on YouTube too.
What's it called? So I can go subscribe to
it. But it's about my battle with FND and how my battle started. And how
Brave
I fight
Muriel,
with a
is that what
smile.
it's called?
My YouTube channel is called The Brave Muriel.
Okay, I'm looking it up right now, and I'm going to subscribe to you.
Yeah, I'm trying to get more people like me to subscribe to my channel.
Same here. We'll spread the word, won't we?
Yeah,
Mm.
definitely.
Yeah.
So I've noticed
Also
on you.
later when y'all sorry, stuttering. When y'all guys, can you please I'm talking to people. Honestly, I didn't think my caregiver would let me do this.
Oh,
I'm honored to be here with you guys.
That's good.
Oh, we are very glad to have you here.
Yeah.
Very, very
Yeah,
glad to have
so
you
if
here.
you guys haven't watched my documentary yet, it's called The Life of the Brave Muriel. Yep, it's that one. It's that documentary right there.
Seen part
I
of it. I've seen part
The Life
subscribed.
of the Brave Muriel, an FND battle.
I
Yeah.
subscribed, honey, and watch it
I'll have a
definitely.
look.
I for sure will watch it.
It's inspiring, but also one of my friends says it's kind of depressing too, so be prepared.
Well, you know
We
what?
have up and down,
Yeah,
so it
that
doesn't
depends
matter.
on how you go into watching something, right, B?
Yeah, yeah. So I'm looking forward to seeing more.
It's
Yeah, don't
my
worry.
goal whenever I made the video was not to make it as depressing, but rather make it bittersweet.
That's
You know
good.
what, Muriel? Mine started out that way too. If you went back and look at some of my old videos, they were depressing in the beginning, but I'm making that a change. I'm making a change in
Yeah.
that direction, and it's uplifting and I found a community that's so compassionate and heartwarming and so loving. And I'm glad that you're
Yeah.
with us. You are welcome anytime.
It was
We
probably
do that.
depressing when my friend watched it because he didn't finish it all.
Oh,
Yeah.
don't worry. We'll promote it's in
He
our
got
channel. We'll let people know to watch your documentary. So don't worry.
Sure. I'm going to post it in my
yeah.
Facebook group.
I'm trying to they don't I've been trying to find Make-A-Wish. Can you please not bother me? I'm talking to somebody.
Was it me or you downloaded music maker? Yeah.
I'm busy talking to these people, Desiree. Sorry, my younger huh?
You're fine. You're fine. We're
One
very relaxed in
of
this
my
group.
younger counterparts was talking over me.
Okay.
That's okay.
She's
That's
not a
okay.
biological sister, but she still counts as my sister.
That's good. Good that you have
It's
one.
good to have a big family group, so it's good. So
Right.
yeah.
We're
Extended.
so excited to see you here.
Yeah.
Oh yeah, you wanna hear my opinion about FND research?
Sure.
So my opinion is that they should research more on the neurological side of things rather than the psychological side of things, because my opinion is they do that too much and they're not going to find enough answers if they keep doing that. What do you guys think?
Yes and
Definitely, yeah, but it's also neurological, it's a nervous system, and also the guts. It's all connected. So
Yeah.
the
Yeah,
psychological
but they do too much psychological research.
a lot of
They don't do enough neurological.
Yeah.
Is what I'm feeling. They don't do enough neurological. And also there's this wonderful nonprofit that I'm part of that y'all haven't heard of. Sorry.
What's it called?
But it's
Not defined by FND.
okay.
Okay.
Also,
Yeah,
look into that one.
except for you might not be able to go to their website today because their website's down.
Okay.
For some reason.
Keep that in mind.
But they do have YouTube.
Are you able to be on Facebook or no?
Yeah, that's how I got here, was because I was on Facebook.
Okay, good. So you are a part of our Facebook group.
Yes, I am part of your Facebook group.
Awesome. Good.
Hang on,
Good. That's good. You can post you are allowed to post a link to your YouTube on there.
Somebody left the fridge open and it started blinking, but it wasn't fast enough to trigger a seizure.
Oh, okay. Now, do
But
you get
the
both?
blinking was still getting to my nervous system, though.
Do you have both types of
You-
seizures or just one?
You explain about yourself a bit to the group. I mean, to people, so they can explain about yourself, so people could know about you.
My name is Muriel. I was diagnosed. Well, a lot of people. Sorry, I'm having cognitive issues, if you can tell.
Don't worry.
Take your time.
We're
We're
very
not here to
patient.
judge.
I gotta think about how I'm gonna start this.
Mhm.
My name is Muriel. Many people, about 176 of them, know me as the Brave Muriel.
Mhm.
I'm, and a lot of people say that I'm the bravest and the most inspiring person they know. And I was diagnosed with a devastating neurological disorder called functional neurological disorder on June 2nd, 2023.
Okay.
And it took me 16 years to get a diagnosis. Believe it or not, my first symptom started at 4 after being thrown across the living room. I hit the top of my head on the ceiling in the back of my head on the wall, and I slid down. I believe what caused my FND was that because my balance issue symptoms just got a little worse after that happened. So I believe my FND was triggered by a head injury.
Yeah.
Yeah, except for nobody found anything because it was too late by the time I had gotten MRIs and scans. Reason why I didn't tell anybody whenever I was younger. They'd probably find something if I told them whenever I was younger, but I was too scared because I'm not gonna say the other word. I'm just gonna say unalive so that y'all don't get demonetized. I don't want that anything bad to happen to your video.
Were you ever diagnosed with traumatic brain injury at the cellular level that they cannot see on scans? Because I was diagnosed with that before FND from a head injury myself.
No, I wasn't diagnosed because I wasn't diagnosed with TBI at all because they couldn't see anything.
Well, that must have been a mistake on the doctor's part because they do not have to see something to have a traumatic brain injury diagnosis.
Yeah.
I was whenever I was younger, and I didn't tell my mom because I didn't want to be unalived.
That's all right. Yeah. We're not scary people. We're good. So don't worry.
How old were you?
I was a 4-year-old, which means it took 16 years to get a diagnosis.
So you're a young lady, a 20-year-old beautiful young lady, aren't you?
I'm 21 now.
You're 21 now. Okay, give or take 20. Okay, I was close. So you lived a long time with this, and you literally could have also, with FND, a traumatic brain injury at the cell level. There is research out there about that. And it's my doctor diagnosed me with mine without any scans. It doesn't have to be seen on a scan. But if you go to a doctor, they take all of your symptoms.
You guys please be quiet?
And they can diagnose you based on your symptoms and the fact that you were hit in the head. That's all I
I didn't know that because I've always been told you have to that we have to see it, otherwise it's not a TBI.
need. You need to find another doctor, Sweet Pea. And I'll go get the research and pull it up and put it in the group for you. How's that?
You can send it to me in Messenger and I'll look at it. And I will send that to my mom.
You got it. I will do that for sure. It won't be just one. I'll
Can
send
you
you as much
please,
as I can.
guys, can you please stop fighting so I can hear them?
Young are they?
You guys were trying to say something, but they were being too loud. May you please repeat yourself?
How young are your siblings? How young are they?
They're not biological. I'm in a care home that has other people. One of them is visiting my caregiver's daughter, and then my caregiver's daughter was fighting with the other one.
Okay.
It's just being typical siblings. So what we were saying before is I will give you it'll be several articles that I find useful. Are you in the United States?
Mm-hmm.
Okay, so then I will make sure that there are articles that, are kind of best fit that the neurologist would understand that, United States, Europe kind of things that are close to him, Canada. So I will send those articles to you. I'll also post them in the group as well because it's important others know that after this meeting we had with our doctor that we realized FND can come from a host of different things. Doesn't have to be just psychological issues. It can come from any type of trauma, including head injury trauma. FND can come from that.
Have they done any research on why non-epileptic seizures are caused by flashing lights if they aren't caused by electrical discharge like epilepsy?
That's big, specific.
Same thing as epilepsy. That's the same thing as epilepsy. Flashes of lights. It's the same thing. With
well, no, because the epilepsy is brain damaging.
For me, flashes of lights triggers me.
But that's okay. I get.
Yeah.
Why does it get triggered? Why does flashing lights trigger non-epileptic seizures?
That's what her question is. Why is it triggering us? And we don't have epileptic seizures. They're non-epileptic. So why does it trigger us?
I have a theory about that. I have a theory about non-epileptic seizures.
Let's hear it.
So rather than us having where our brain has massive amounts of electricity going off abnormally. It's probably with us. Can you guys be quiet, please? With us, it's probably neurochemical rather than neuroelectrical.
You're absolutely right. I agree with you.
And my
100%.
theory comes from an article that was shared to me by non-defined by FND.
You have to share that.
Ow, they're yelling.
Does noise bother you?
They're yelling.
Does noise trigger you and set you off with symptoms?
No, it just really hurts. It really, really, really hurts because I have pain from my head down 24/7, and sometimes noise will amplify the pain.
Mm-hmm. Do you have earbuds that helps you?
I don't have any earbuds nearby. I don't think maybe my caregiver has any that will work with this laptop.
Because I'm very sensitive.
Let me finish my theory. I didn't get to finish before they started yelling. My theory is that our seizures is caused by neurobiological, meaning by neurochemicals rather than electrical signals. Because there's this one article I read that says that there's this neurochemical called neuropeptide Y that's either higher or lower when we're having the seizures. It says something about neuropeptide Y being either higher or lower in people with FND.
I know what you're trying to say.
Yeah.
Yeah, except for the fact is I'm having issues because I can only remember that part of the research study.
Well, let me explain a little bit, because I used to teach how the brain worked, believe it or not, to my students that I used to teach to. Part of that reason I taught them how the brain works was because, one, I was teaching kids with special needs that needed to learn coping skills and how their brain is working. They needed to understand why those coping skills were necessary. So basically, I would describe the main parts of the brain and their functions. But then I went down to the part of the neuron, which is one of the most fascinating parts of the brain that many people are kind of like, so it's like a mystery because you can't see it. That's the part you can't see. The neurons, the tiny microscopic parts. But they know that these little neurons have these little dendrite tails that come out, and then the tails spread off like this, like a little, these little finger-like things.
Oh yeah, I've watched a YouTube video where there was a neuron trying to attach to other neurons under a microscope.
These attachments, these dendrites, the little finger-like things that connect each other, when they attach to send messages, they do it two ways: electrically and biochemically, with chemicals. Those chemicals, and sometimes what happens is if the shape of the dendrite or the shape of the neuron is shifted in the wrong way, it's having a difficult time receiving a particular messenger that used to fit into it correctly, but no longer does, or the opposite. The can't send it because it can't.
That further proves my theory. That
what?
That further proves my theory.
Yeah, there's a lot of information. I did studies when I was a teacher. We had to do studies continuously, but I had to do a study using various different coping skills, but gathering the data and the information, and it was teaching a curriculum about the brain, how it works, and why trauma can affect the brain. And so we had to teach this. I had to study it myself, then teach it to my little kids, my little students, because their lives were faced with a lot of trauma and they needed a lot of coping skills. And sometimes if you're teaching something, kids want to know why. Why do I have to learn this? And it was really, really important for them to understand why. Because if they didn't learn those coping skills, they couldn't fix what was broken in the brain. And when I say that, it involves neuromuscular, and we can fix. And that's why sometimes that's why they send us to psychology, because the brain as a whole is a psychological and a control center of the body. It works all the time. Both parts.
Do you ever? I have a question real quick. Have you ever heard of? There's this one study that shows if you're not diagnosed on time, then the prognosis is poorer.
I've seen that. I think I've seen them in the past. I
And
don't
with
remember.
with my FND, it's kind of leaning towards that way because now nothing I do helps me.
Mariel, you're in my group, right?
Yeah.
Okay. Do you remember? Have you ever gotten the opportunity to see me go on live and read this?
The Power of Now.
It's a pretty good book. You should
Oh,
listen
yeah,
to
I've
the.
never read that before, but
I have some
I
good
don't
news
really
for you.
I don't really have the money to buy one either.
Guess
No,
what? You don't need the money, honey. I did it for you. In our group, if you can get your caregiver to teach you how to go into guides in the group, I have the reading. I read it piece by piece to you all and saved the videos for you to access as you need them. You can also listen to it online on YouTube. The author reads it himself. The only thing about that is his voice is so soothing that it puts me to sleep and I couldn't get through the book. So I had to go and read it myself to all you guys. And so it's in the group. You can access. I do not want anybody to have to go buy anything. That's another reason I created the group too. I want to be able to offer resources and skills and things that we can do to fix our brains. Holistically, not with medicines, because I already sometimes feel that it's not going to get us much anywhere with constantly taking medicine, because even medical medicines can even
I
cause
have
these.
one medicine that's gotten me somewhere.
Yeah.
I have one medicine that's gotten me somewhere with my seizures.
Yeah. What is it?
Um,
You don't remember the name of it?
so it's a medicine. It's a medicine that's both an anticonvulsant and
that's helping you.
Yes, it's helping me for some reason.
How many times have you had an EEG? Usually anticonvulsants don't help non-epileptic seizures, only epileptic ones.
Whenever I take psychiatric drugs by themselves, it doesn't help. But but for some reason, when the medicine that is an see, what ended up me taking is because an anticonvulsant medicine is because it is also a antipsychotic, and I believe I think the anticonvulsant properties are also helping me, because whenever you put me on antipsychotics by themselves, it doesn't help. But boom, when you give me anticonvulsants, it helps.
I got it. I get it. Because then that shows the chemical. That's why you were so for this chemical research, and because it's you've combined a certain type of chemicals that work to replenish what you're missing. And
I've been on Keppra before, and that's just an anticonvulsant, and it helped me.
Yeah.
For the short time that I was on Keppra, it helped me.
Okay. We have lots to talk about.
Yeah, we do.
I hope that we see you again. I've been on here now for almost 3 hours, honey. And I'm super tired. What time zone are you in? Like, what time is it? Muriel.
What times am I on?
What
so
times,
I'm on.
Yeah.
What times am I on?
Yeah, like what time is it where you're at right now?
7:57 p.m.
Okay, it's 8:57 p.m. for me, and I've been on since 6 o'clock or more before 6 because I have people jumping in. So I've been on here for almost what, 3 hours?
Has it
My
been that
body
long?
is starting to
Oh Lord.
get really
And I've got tomorrow morning the Zoom chats still
Yeah, you
to carry
do.
on.
B, you
Yeah.
need to go. You for sure
I
need to
need
go.
to get my little sleep
Yeah,
before.
I wish I could share more of my videos in your group so other people could subscribe to me, but
Muriel, you can.
I
My group
can.
doesn't have Yeah, I don't have regulations like that. There's nothing wrong. You can go ahead and go click on your own YouTube channel and post it as soon as we get off of here. I don't have regulations on that. Please, by all
A
means,
lot
go
of
ahead.
FND groups say no advertisement, no advertisement.
I know they do, but you're not advertising to sell me something. You're showing us your story, your testimony, and what has happened in your life.
Exactly.
That's what I want our group to be able to do.
And I thought asking other people with FND was asking other people with FND to subscribe to me was advertising.
No, they can choose to subscribe if they'd like or not. I mean, say, hey, why don't you check out my channel? You can put in your channel.
Yeah.
Watch my story. I made my story here.
When you guys are done, can you send me? Can you DM me on Facebook so I can send you friend requests?
Hold on a second. Let's see. Muriel. I'm doing it right now so I can see.
I'm on Facebook as Mimi Davis.
Oh, okay, that helps. Thank you.
Yeah.
Oh, I also have I have a page called The Brave Muriel on Facebook. I'm the Brave Muriel on TikTok as well.
I found you.
Don't worry.
And then I have my own Facebook group as well.
You're very
I'm sending you a message right now.
I love that you've done this, and I'm glad you shared your story. So
You should be getting it. I just sent it, honey. So you can see that when you get done, and then you can have a link. My name is April, but guess what? I also go by Mimi as well.
I like to be called the Brave Muriel a lot, though, too.
All right, I'll try to remember.
I'll try to remember. Facebook. I just put my Facebook as Mimi Davis so that cyber bullies won't find me.
That's great. We have to protect ourselves, and that's what I'm working hard to do in my group. Actually, no, I'm not. B is our private investigator over there. She's doing a great job keeping out these scammers and spammers.
Thanks for subscribing. What number subscriber are you to my channel?
Do not know. Probably your last one, maybe. I don't know, unless it's going viral right now as we speak, and you're getting a ton of them now. Let me look. Let's see my subscriptions. B, if you need to go, you can. I'll hang out and
Okay. Bye. I hope to see you soon.
Bye. Remember to subscribe to me. I'm trying to get to 1,000 subscribers.
Yeah, don't worry. We'll share out your story. Don't worry. Okay.
Okay. Thank you, friends.
You're welcome. Yes,
Let's
right.
do the friends pump.
Friends
Ready?
fist bump right here.
1, 2, 3.
Yay!
Oh, yeah, gotcha.
New
Awesome.
FND friends.
That's right.
See ya.
I got new
Bye,
FND
B.
friends.
I'll stay right here with you, Muriel, for a few moments, okay, honey?
Okay.
So,
my main wish is to have 1,000 subscribers.
So is mine. You know how many I have yet? I see you have 177 now.
Awesome. Thanks
I
for being
have-
my 177th subscriber. Also,
Absolutely.
you know
You know-
what?
Are you subscribed to mine?
Yes, I'm subscribed.
All right. So we are friends and subscribed with each other. You know what? We can connect and do a Facebook Live together. Did you know that?
Really?
Just you and I? Absolutely. We'll have to work on that.
Awesome. So I'm on Saturdays and I'm on Saturdays and Wednesdays.
On Facebook or YouTube or both?
Actually, I'm everywhere then because yeah.
Busy day to be able to be on the computer.
Yeah.
Wednesdays and Saturdays, you know, but that's an awful lot of stuff for me. You know how many people I have in my Facebook group now? I'm almost have 3,000. I almost have 3,000.
3,000?
3,000. And the numbers went down a little bit because we had to.
Are you the owner of FND Friends?
I am the founder of FND W.A.V.E.S, and I created that group. And
FND W.A.V.E.S. Oops. I mixed it up with
FND
FND Friends.
That's okay. That's okay. FND W.A.V.E.S. Yes, I am the one that created
Is
it.
FND W.A.V.E.S a nonprofit too?
I'm working on building that. And like you, sometimes I can't afford things either. So I'm working to reach out with community and spread the word and build up my channel.
I know one thing you could do. You could ask, not defined by FND, if you could get together with them.
Who is it?
Not defined by FND. They are on Facebook too.
Not defined by FND.
And they're a nonprofit. Oh, you want to know another issue that goes on with people with FND? There's so much stigma that not even insurance covers what we need.
Yeah, I know. I hear that.
And it's worse in the US than
So
in
what
the
they
UK.
did, they went backwards. I see what they did. They might have gone backwards. Have they created, they actually have a nonprofit organization started?
Yeah, but I was a part of it. I was a volunteer way before they became a nonprofit.
They only have 32 members.
Yeah, you should definitely in the group ask the other group members to be part of them.
Thank you for sharing that with me.
My friend Kim is the founder.
Kim, okay. Thank you. I will try to reach out to them. I actually see a couple other groups that would be helpful to.
If you check the top, I have links on my YouTube page. I have a Discord that you should join.
I actually saw that. I am not very familiar with the Discord platform, and it gets me really makes my head just spin when I try to learn new technology, because I'm still trying to learn this functioning of Zoom and the Facebook admins and all of this stuff. It's like, so I can't take on something quite new yet. This going to Discord, because that's too much learning at the moment as I'm trying to build up the activities we're doing in our group. You also know what else we do? If you go into the Facebook group, the FND W.A.V.E.S group, into the guides section at the top, we started doing DIY therapeutic activities together, and somebody teaches a class every Monday. And one Monday we taught one of the members taught how to make dog and cat treats. You could sell them. One person taught how to crochet and make a scarf, and B
Yeah,
that just
except
left.
for I don't do a lot of DIY because I don't have the money to do that.
Well, one of those things is the dog treats. You know what it takes? Flour,
What?
flour and pumpkin. The canned pumpkin, that's it. You can make your own money making those and sell them to people with dogs or cats.
Oh, yeah, we
That's
don't
why
really have any of that around the house.
But that's why I try to offer the DIY stuff, not necessarily for you
We
to go
do
out and
have
have
a
to
lot
buy
of
stuff.
we do have a lot of paper though.
See, we were coloring the other day. You can use that paper and draw pictures alongside us.
Oh yeah.
Yeah,
Hey, I want to show you some of my art.
I'd love to see it.
Right there, I was just trying to make sure I didn't trip because I have a hard time picking up my legs when I walk.
Pretty true sometimes. I cannot
Okay, I
use
have a
steps.
lot of art upstairs, and there's
Yeah?
more in the garage. But I'm just gonna show you the ones that I can show you.
Okay.
The ones that I have. So I have this. Um, I think it's Frozen.
Yeah?
It's Frozen.
It is frozen. Is it frozen on my
Darn
end
it.
or your end? All right, you're
No,
frozen.
it's my end that's frozen.
I see it because I can move my head and it's moving in the video. It is frozen.
Yeah, but now you can only see. Can you help me fix this so I could show you my art?
The only thing I know what you possibly, the problem possibly could be is that you're too far away from the Wi-Fi signal. So
Okay.
it's slowed down that it's possibly slowed down your connection with your video part.
Okay, then I'll go closer to it. I'll just bring all my art downstairs.
Yeah, well, there you go. That might help. I'm hoping that'll
Another
pop back
piece
on.
of art. Another piece of art I have is on my cane.
Oh, really?
My cane's decorated too.
You know what? Do you still have the link to get back on here? Sometimes going off and coming back on helps.
What'd you say?
Do you still have the link to get back onto the meeting? Because sometimes leaving it and then coming back on will help regenerate that technical glitch.
What'd you say?
Do you still
They're
have the
being
meeting
so
link?
loud. I gotta turn up the volume. Okay, repeat what you said.
Do you still have the meeting, the Zoom meeting link that you can get back on? If you get off and then come back on, it will kind of help the glitch that happened.
Yeah, I still.
So if you leave
I
the
think.
meeting and then click the link, you can come back to the meeting again and it should regenerate a better access your Wi-Fi. It'll pick up better.
Will you please wait for me?
I will definitely wait. How about 5 minutes? Because what happens if you keep trying and trying and trying and trying and trying? I don't want to stay up all night, honey. I will definitely wait 5 minutes. Okay. What are you doing? Well, we've had quite the Zoom meetings today. Oh, what are you doing? Parkour, stop. Stop. Boys, stop. Hi, Muriel. I see you're joining. I waited for you, honey. You made it. I can't hear you, but I see you this time. So now it's the opposite. So I see that it's trying to pick up your audio. I'm looking for something. There we Yadira. I still can't hear it. You need to hit the audio button that says a microphone. If you click it, the microphone. There we go.
Hi.
Gotcha. Now I hear you. Let's see your art.
I know I'm at level 20.
I love it.
It says subscribe to the Brave Muriel on YouTube.
Sorry.
This one also says the same thing.
Smart idea. I never thought about doing that. That's a smart idea.
And then this one has my wish on it. And also one thing I've been trying to do
What's that?
is get into a Make-A-Wish program, but they don't have any for adults with disabilities like us.
I know.
So I'm like, well, why not? Well, why not try making art about it and then showing it to people?
That's a great idea.
This one says subscribe to the Brave Muriel on YouTube. My wish is to become famous for my brave and inspiring battle with functional neurological disorder. Help me reach 1,000 subscribers. Now that's just the first. That's just the
First wish. That's just your first wish, isn't it?
No, not what I was trying to say. That's the first milestone in being a YouTuber.
Oh, okay. Yeah.
I want to have more subscribers than Mr. Beast.
I don't know who that is, but I'm aiming for the same goal that you are as well. And if we keep sharing each other's YouTubes to others, then that will help increase our subscribers, won't it?
Now I've got confirmation from the owner that I can ask people to subscribe because you're the owner.
Yeah, that's right. Yes, you can.
You said I can.
So you can put your channel as a post and say, would you mind you watching my story, subscribing it and sharing it with others?
That's what I'm gonna do.
Okay. That's perfect. That's all you need to do. So what we can do, isn't it?
Yeah.
We just keep going.
Oh, you want to see my bracelets?
You make those?
I made this one.
Oh, that's nice.
And it's a weave that I did by myself.
Oh, okay, I see it.
Weave called the Muriel weave because it's a type of weave that I made up.
Oh,
and you don't need any of those little things that you use to sew it. You don't need any of these.
Muriel, you could teach a class for us. You could teach a class in our group, and you could sell those and make some money, honey.
Yeah.
You have a talent.
Except for my caregiver says I can't really sew anything yet till I get my own device. This, what I'm on, is her computer because my phone broke when I had a seizure. A couple years ago, I had a seizure and my phone was in my hand and the seizure was so powerful it crushed my phone.
You didn't have a strong enough cover or protector on it?
No.
Like that really strong? You need a really strong protector or cover on it to keep it from breaking.
I didn't. The kind of weight that my seizures produce. Like one of my friends said that I'm stiff.
Yes.
Convulsing stiff when I have them.
And that's, doesn't it cause a lot of pain afterwards?
Yeah. And then in 2023, I started getting paralysis after them.
No.
Where I'm either paralyzed from the neck or the waist down.
I've been getting those myself. It's kind of scary. I've been getting those myself this year. This is the first time I've ever had them.
Does it paralyze you afterwards?
No, I've had the seizures since the beginning for the last 5 years, since I've gotten FND. This year is the first time I've had the paralysis. Can't move at all.
After them?
Yeah. Mm-hmm. And I've become paralyzed sometimes without even having a seizure. It's just paralysis, complete paralysis. Somebody's playing Mario. I recognize that sound. I am going to
okay, here's
I know you're
excited.
Oh, that's pretty.
It says not defined by FND.
I like that.
And then it says FND warrior.
Yeah, that's what the W stands for, FND W.A.V.E.S. When I have FND, when it's called FND W.A.V.E.S, W is for warrior.
What's the A.V.?
A is for advocates. V is for victims. E is for enigma. Enigma is kind of a strange, unusual, not very understandable thing. And then finally, S is for sometimes we feel like we're just survivors.
FND.
I like that. You have quite an assortment of bracelets.
And this one says chronic illness fighter.
You made all of these?
Yeah, I make them whenever my ABA comes here, because I'm autistic too.
Oh, wow.
A lot of us with FND have this issue where our autism.
I know.
Where a lot of us have autism.
I have seen that. I wonder what the correlation and why
it's probably the way our brain is connected.
Yeah.
It's probably,
but I also see there's correlation with autism and some other different disorders. My son has a disorder, genetic, he was born with. And that
this
disorder.
Is my rabbit. His name is Blue.
That's cute.
And he has a collar with a bee on it.
I like that. You want me to show you what I have?
What?
You know what? Hold on, I'll get it. I'll show you. This gives me joy. Hold on. What are you doing?
Yeah, he is. Yeah, so we want to buy this game. Please. It's not buy. Get. Can I get this game?
Yes.
A puppy!
Brings me joy.
Why we asked me told you is because yesterday
he is deaf. He cannot hear.
Do some questions and see, check on you, and
that's so cute.
And he also has a little bit of vision impairment. He gets quite jumpy because of it, but he's so sweet.
Does he have the app store?
You say hi.
Does he bark?
Yeah, he can, but he doesn't do it very often. But he has a brother, and his brother teaches him. So when he sees his brother barking, then he starts barking.
I have vision impairment, and I'm blind in my left eye, and I have tunnel vision in the right eye.
It's yeah.
But I was checked to see how much damage I have, and I don't even have enough damage to be in my eyes to be causing that. So I think maybe my FND is the one that has taken most of my vision.
You know what I think? It's just my opinion. Just my opinion. I think it's more than that. I think it's probably the nerves, the neurons in the brain from your head injury.
It didn't happen. It didn't happen right after I was thrown across the room.
It doesn't have to happen right after. You know why?
Why?
When you hit your head, if you've been in an accident of some sort, first comes this motion, back and forth. When that
my
stops,
brain looks completely normal.
So does mine. But when that stops, your brain keeps going inside the head. Once that stops, the neurons keep going inside the brain. It could take a while for those neurons to stop moving from the impact of a head injury. And sometimes they might have permanent damage that they can't see them because their neurons are microscopic.
Oh, and I even finished my favorite movie, Miraculous Ladybug.
Tell that to my mom.
Maybe one day I can meet your mom and she could jump in, because I am going to try a caregivers group too, for people that care for their loved ones when they.
My mom thinks I over exaggerate things, but in my opinion, I don't. That's why I don't trust her. That's why I'm like, tell that to my mom. Tell that to my mom, because she'd regret everything she's saying.
Challenges we meet sometimes in the relationships we have makes it a little difficult.
And because it's my body, I notice my issues way more than other people.
Well, of course. You will always notice it more. It's your body. You know yourself better than anybody else.
Yeah, so I'm lonely. Oh wait, I forgot to show you my cane. The art on my cane.
Hi, I'm going to take a look at that art, and then I'm going to have to get going here. My doggies need to go potty, and I'm getting very tired. I like that. Is it bedazzled? It's got like sparkles.
Muriel from YouTube in the back says, "The brave Muriel from YouTube, raising awareness, helping others feel less alone, and kicking FND's butt." And the side has hearts on them, but it got rubbed off, and it has some yarn around it.
Do you have sparkles on it, or is that just the gloss from the paint?
Huh? It has what?
Sparkles, like little crystal sparkles, or is it gloss from the paint? It looks shiny.
Actually, this is tape right here, and then it's painted on the sides.
Gotcha. I like it.
And then this right here, that it says FND Warrior.
That's right. You got it.
And the year that I lost most of my vision, by the way, was 2018.
Yeah, very somewhat recent. 18, 19,
2018, several years ago.
That's 1 year before I got FND. So 6 years ago.
And I had my first seizure at 11, and BTW, the first one, almost killed me. It was to the point where I had an NDE and an out of body experience whenever I was losing oxygen. God was like, if you don't want to go to heaven right now, then do not look up at the light.
You have a fascinating story, Muriel. I look forward to watching all your videos.
Yeah.
Fascinating. You're an amazing person.
I have a video on my YouTube that talks about how FND destroyed my life.
But you know what? You have the
What?
power to change that and look at it in a different way. You ever think that FND could be actually a blessing? To give you a special gift? The gift to be able to think deep.
I've always thought about FND as a blessing and a curse.
Well, yeah, you're right, because sometimes it can be, especially when it changes our lives in the way not that we wanted. So that's like the curse part. But the blessing is the people we meet seem to be so compassionate, and that we are able to take time to stop.
I've just kind of started accepting it, but there's no getting away from the grief that it causes. There's no way.
There is, because it worked for me, and we'll work on that together if you'd like, honey.
What did you do to get away from the grief?
Well, it kind of goes. Oh, hold on.
Are you okay?
Sorry. Get him.
Oh, hi.
Sorry.
Hi.
Hi.
Maya, get him. Sorry. Here I am live meeting, live YouTube, and my dogs went on full on attacky mode. I just broke up a dog fight. Bad doggies. So sorry. So welcome, Michelle. I was just getting ready to answer a question.
Is she new here?
I have not seen Michelle yet.
Hi, Michelle. I'm the brave Muriel from YouTube.
Hey, can you see me?
No, your screen
She
just
probably
says
just
Michelle
wants to sit back and listen.
Swindison.
She probably wants to sit back and listen for a moment, or she might be having technical difficulties, but I'll allow her to jump in when she wishes.
Okay. Yeah.
I wanted to introduce myself to her.
Okay.
My name is Muriel. I'm a YouTuber, and I'm battling FND. If you want to know more about my story, you can watch my new documentary called The Life of the Brave Muriel and FND Battle.
Thank you for sharing that.
And
Muriel.
before she came in, I was trying to say, I've kind of accepted that I have FND and that I'm not able to improve it. Sometimes you can't change things that happen to you, and I've just kind of accepted my fate.
Right.
It's a mixture. It's a mixture of peace and grief.
It is, if we allow ourselves to get stuck in that grief moment and get stuck and stay there in the mind. That's what I was talking about before Michelle jumped on. There's a way to escape that from our past thoughts in our minds. You just practice meditating and just pick something that you love, whether it's nature, whether what feels good to you. Pick something like that, and you lay there quietly, put on some music that you like, and meditate and practice thinking of that.
I'm not trying to be mean or anything, but yeah, I've tried actually meditating before. And it doesn't exactly work very well.
It didn't actually work for me very well either in the beginning until I read a different book that taught me how to do it differently. Does that make sense?
What did you use? The law of attraction?
Did I do what?
Use the law of attraction.
No. Actually, hold on a second. My dogs are being very naughty right now. Very naughty.
Dad doggies.
Yeah, they're wanting to attack.
Mm.
I do need to take them outside. Hold on a second. Maya, they need to go outside. Bad. All they're doing is staring each other down. They're going on full on attack mode and they bit my foot.
Guys, you want to see my art? This one says subscribe to the Brave Muriel on YouTube. My wish is to become famous for my brave and inspiring battle with functional neurological disorder. Help me reach 1,000 subscribers.
There she is. Hi, Michelle.
Hi, can you see me or hear me now?
Yes, I can.
Yeah, I can
Okay.
hear
How are you
you.
doing? Welcome.
What? Oh, thank you.
You like my art?
Subscribe to, yes, that's very cool. I will check it out.
She's gonna post it in our group. You'll be able to see that then. She wants to do that. How are you doing,
And
Michelle?
I forgot to show this one off too.
Muriel, I'm gonna give Michelle some time to talk. Do you mind?
Okay,
This
you
is-
can take your doggies out and then you can come back if you like.
Well, no, I'm gonna sit and have my daughter take my doggies out, and I'm gonna let Michelle have some time to talk and chit chat. How's that?
Okay.
Okay. Thank you. Here.
Oh, I don't know if I had all that much to talk about, except I've discovered my FND is brought on by extreme stress and I can't think of the word, but basically the word for extreme stress, there's a better word for it. But I've definitely noticed like the dystonia stuff. I can be almost well, and then the dystonia will hit under duress, or you know what I mean. I can't think of the word. And so I think for me the big thing is limiting that stress and staying away from people that cause it.
Really,
And that's been
My
a hard.
FND is rarely triggered by stress.
Huh?
My FND is rarely triggered by stress.
Really? Oh, that's like my primary.
Well, I have a host of stress. I have a
My
host of
FND acts like a progress. My FND acts like it's a progressive neurological disorder. Because
Yeah,
as
I don't.
I've gotten older, symptoms gotten worse.
Yeah. It can get better though. Last year I was in a wheelchair in April of 2023.
Can I ask a question?
Mm-hmm.
Did your insurance pay for it, or did you have to pay for it out of pocket?
My insurance paid for neurological physical therapy.
That's good.
And
my insurance won't even pay for that.
That's too bad, and I'm so sorry. The best advice I can tell you right now is to go get like if anybody in the house has any type of weights or a weighted blanket, and you put it around your shoulders and you sit upright in a chair with your back against the chair and your feet on the ground, and you put that weight on and you just sit there and take deep breaths. And I will almost guarantee that will help calm things down. The day I went in and the first time my therapist did that to me, I cried in relief.
It's amazing, isn't it?
Yes.
When you find that one thing that finally gives you that, oh my gosh, didn't think I'd ever find this one.
I didn't ever think there was hope. I really didn't. I thought I was wheelchair.
And look at you, you're moving. I see you moving all over. Good for you.
Thanks. Yeah, it's
honestly.
No, I did quite a bit now. I went from a wheelchair to I just got back from riding my horse up a 14er. So
Yeah.
I do believe there's hope for people. I hope that you can see that hope.
Did
And
your insurance cover your wheelchair, or did you pay for it on your own?
the insurance paid for it, but I'm giving you the best piece of advice that I got from that, from my overall sessions. And I hope I don't lose you again. If I do, I'll drop you and come back.
That's right. Yeah. So, Muriel, you
yeah,
have
just
to write.
go.
Muriel, you should come in these
I'm
meetings
gonna go
with a notebook.
close to internet.
Okay, that sounds good. Muriel, you should come into these meetings with a notebook and pen and jot down notes.
Yes, she
It'll help
really
you.
that would be good, because you're not gonna if you're anything like me, you're not gonna remember, or at least can you still hear me?
Yes, I
Yeah.
hear you.
Okay, because you're not gonna remember what I said tomorrow.
Right. So write down weighted blanket.
Yes, weighted blanket.
I know you said you don't have money right now, but this is something that you could put on a wish list for a gift.
Yes, or
people you
even
love or
it doesn't
caregivers.
have to be a weighted blanket. The therapist with me used 2 ankle weights. She hooked them together and put one on each side of my shoulders.
Mm-hmm.
If you guys want to send me gifts, my caregiver allows me. My caregiver allows me to.
I would love to, Muriel, but unfortunately, in my circumstances, I'm trying to start
No,
a
I'm just saying,
nonprofit.
if you guys ever wanted to.
I
My
love you.
caregiver
You're so
allow
cute.
it.
You're just you're adorable.
Me?
I wish I could. Yeah, you are. You're absolutely adorable. And they're just so sweet. And I'd love to be able to send gifts, but I'm working on so hard to be able to develop. I can't work anymore, and I don't make money myself. And I'm working on trying to build a nonprofit to help people like you and like Michelle and like me. So I would love to send you gifts, but guess what? If you post and you get those 1,000 subscribers you're working so hard for, they can send gifts too. So I don't have a problem with you posting your YouTube or what you're doing. So you go ahead and share that that's your story. You share it in our group. That's fine.
Yeah, and you can share your needs in that as well, and maybe somebody would share you or send you a 5-pound set of ankle weights or a weighted blanket. I mean, ankle weights, you might even be able or have your care provider go to Goodwill and pick them up really cheap there.
You can even make them yourself.
Yeah, you can even make them yourself with rice.
Rice, dried beans, or dried corn,
dried beans might be heavier than,
or popcorn.
You want something
popcorn kernels.
Popcorn would probably work.
A lot of so as you've guys been telling me all that, like about the meditation stuff and about all the other stuff you do that help you guys, and I've tried a lot of that stuff before and it hasn't really helped me that well.
It will when you're ready. That's all I can say.
Even if at all.
I can only say it will when you're ready.
Yeah.
Do you agree, Michelle?
Yes, I absolutely do agree. I do agree that you have to be willing and ready and positive about it.
Mm-hmm. And know that you're getting support.
One thing I think might help me is stem cell therapy.
You'd have to run that over by a neurologist. I have no idea.
And there's another person with FND who got stem cell therapy and it reverted all his symptoms.
Wow. You'll have to post that information. Share that with us. You'll have to post that. If you've seen it in a research article, share that with us. That's what the group's for.
Actually, it's a YouTuber who got stem cell therapy. They haven't even done research on that yet. It's just one YouTuber whose neurologist recommended stem cell therapy. He got it and it worked for him. And that for me sounds like something that would help. Like I'm
but I think that
I'm at the point where I think that's probably my last resort. If I try all these stuff and it doesn't help me, all the stuff he recommended, and if I try that for 6 months and it doesn't help, then I'm going to try to get stem cell therapy.
I could see my observations just talking to you this little amount of time. My personal opinion is you have way more than FND going on.
Yes.
Way more.
I 100% agree with that.
Can you observe it in my movement? Are you able to observe it in my movements too? Is it that bad?
Well, I mean, I can be severe too. Don't get me wrong. You didn't see me with anything, but it's just the way the present, I guess,
it's your
I
whole
see
package.
with your eyes. I could see with
I think I might have something genetic going on because I have an overgrown jaw. And I have surgery for it in October. They're gonna move my top jaw forward and my bottom jaw backwards. I have braces on because of it. See?
Yep.
Yes, I see.
They'll break it. Yep. Yeah, I think FND is kind of used as a wide term to say we don't know what the hell's wrong with you.
Bingo.
Except for my FND was diagnosed with Hoover's sign whenever I was paralyzed for 4 days. It was diagnosed via MRI, Hoover's sign, and EEG.
It might be best if you would find a whole new panel of doctors and go in with a whole brand new presentation and say,
I agree.
Let's look at this
new presentation.
Clean
like
slate.
What exactly?
Yes, like a clean slate. Let's start fresh. Don't pretend there's nothing. You don't even know a label, but here's what my symptoms are, and this is what I go through. It would be helpful for you to have a clean slate panel of doctors.
I've tried that before, but my medical records keep following me.
I know. That's where that's the unfortunate, very common thing that happens. And I'm facing that myself.
Yep.
Which probably is why I'm not getting a call for a new doctor right now. They're like, oh, crazy, not going to accept her. And that's the way I think that they're viewing it.
Not defined by FNDs doing something nobody else has done before. What they're doing is they have a petition going on. They have a petition going on to remove old names of FND. And soon petitions, they're going to have other petitions like having one that goes against what do you call it? It's when somebody treats a disabled person that doesn't have a diagnosis good, but then you come in with a disability that's called FND, and
well, I have
discrimination.
Yeah, I know exactly.
And it's all going to be federal level when they do those petitions.
I have a movement going too, a petition going too.
What is it? Send it to me.
I have it in the group. It's actually in the featured part of our group. But it's basically mandating continuous education for all medical professionals about FND in our condition.
That's what not defined by FNDs gonna do too.
Maybe you got it mixed up. Are you sure it's from them and not mine?
Huh?
Are you sure it's from them and not mine?
No, I'm telling you their plans.
Okay, because I got that petition going. You could share my petition with them and then share their petition with me. And then we can all take turns signing them. You know, you can do that. You can share that. Yes, absolutely. Listen, ladies.
Can you
I've been on
Can you-
here for almost 4 hours.
can
Yeah,
you tell
I just
am-
joined because it popped up, so I'm good with signing off because
Okay.
we all have busy lives. So
I have
I know.
another
thank you for
I
doing
have a
this tremendous.
question.
Oh, you're welcome. And I'm glad to have met you, and I hope to see you again in some future ones, Michelle and
Yep.
Muriel. Okay.
All right,
Don't
we'll see you
forget to
later.
subscribe to the Brave
Right.
Muriel.
Bye,
Okay.
Brave Muriel.
Also, I have a question.
One more, and then I have to go, honey.
Can you
What's
tell physically with me that it's something more than FND?
When I look at you, my honest opinion, yes.
When you look at my facial features too?
Yes, honey. Just from my
Another person said he thinks that I have Anderson-Tawey syndrome. He thinks I have periodic.
That's what I'm being
paralysis.
tested for right now. I would agree with that 100%.
But my doctors won't test me for it, and even if it's free, they won't send out the referral for that.
I have just had genetic testing done myself for that exact same thing. You want me to send you a link on where you can get the testing ordered yourself by yourself for free by yourself? I'll send you the link for
If
that.
my caregiver will allow it, yes.
Why wouldn't your caregiver allow you to order
Because
a genetic test for free?
Because I'm in a situation where I'm in what they call TIMEC, and it has to go through them first.
Oh, I see. Wow.
I'm in TIMEC, and everything medical has to go through them first. And they might not even agree.
What if I told you it was free because a program is providing it for free and you don't even have to use your insurance because you would probably meet the free qualification? It's like it's
yeah, but it still have to go through them, sadly.
Well, why don't you ask if they can send me their information and I'll give it to them and they can look at it themselves? Have you shared my group with them? Will you remember to share my group? Share my group with them, Muriel. My dogs are fighting and I gotta get them out, honey. I gotta get going. It was so nice to meet you and I look forward to seeing you again.
Okay. Bye. I hope we
Have a
get
great
to
night.
see you again.
You too, and we will. Have a great night.
You too.
All right, bye-bye.